almost 2, 3 years since I've gone to MG Road. Earlier I used to go every weekend. I used to go. So the traffic has become particularly very bad in Bangalore. And then Professor Kala herself has done some bit of work, and then she has some figures relating to how much time it takes for commuting, and then how this time has gone up over a period of time, the commuting time. So that is one of the things that is mentioned in this seminar. And there is also one student who has done work on Bangalore city, and then the kind of expenditure that is incurred on health because of traffic congestion, pollution, and the various other things, the increase in health expenditure. So this is also something which an important area. Both, I think the two aspects are also mentioned. One is that health related issues and then expenditure. The second one is that increase in commute time and the kind of implications that this has on the participation, workforce participation. So these are the two aspects that are mentioned, but I think there are many other things which are which become important in the context of growing cities. And then important one is marginalities, as basically who exactly, which section suffers because of growing traffic, and then the kind of transport development, uneven transport development, or transport development that takes place in a particular manner. So viewed from this angle, this seminar becomes very important, and then I'm very happy that Sobin, Ajay, Lekha, and Prajwal, you all got together, and then maybe others are also there, but I don't know. And then you all got together to organize this very important seminar. We're particularly proud of this seminar because the kind of the thematic focus you have and the way the sessions are organized. Sobin showed them to me. I was particularly very happy the way they are organized. And then it's so tempting that I feel like sitting the next 2 days here, but unfortunately, I will not be in a position to do that. But I am sure that the seminar will be very important one. And then because the type of issues that are being discussed here, I think they're very important issues from a policy context. And we are particularly happy that Ajay has collaborated with us on this particular in this particular topic. And then he has been collaborating with our institute for the last 1.5 decades. So we are also very happy. And then this has almost like a home. This has become to home to you. And then welcome back to home. And then I just would like to. He's also our keynote speaker today. And then we look forward to listening to him about his views on this particular subject. And just for some of you who are not familiar with Ajay, I just would like to tell you who he is and where he is from. Ajay is the chair in Social Urban Transitions International Development Studies, Department of Human Geography, Spatial Planning, Utrecht University. He also holds Dr. TMA Pai Endowed Chair in Qualitative Methods at Mahe, India. It's an honorary position. And then he leads the research line of global migration, culture, and place, working at the interface of anthropology, geography, demography, and public health. And the other important thing is that he has over 15 years of experience in qualitative research. That is something which is very important because we all believe that both quantitative and qualitative research should go together, and then we need to learn from you on that particular aspect. And he has also led NWO ICSR ESRC project on aging and well-being in a globalizing world. This is one thing which we have the ISA collaborated earlier. Yeah. So in this project, he contributes his topical and methodological expertise, that is basically the qualitative research in working with migrants, lower income groups, and the older adults. Um, uh, he has been actively involved in this project, that is EQUIMO project, and he is also monitoring the project. He co-supervises PhD students, and then our own Prajwal is being co-supervised by him. And then one more person should be there also. Yeah. Yeah, okay. She's there. Okay. So Diva is also there. And then, and also postdocs, and then contributes towards team building across 3 countries. So a warm welcome to you, Ajay. Welcome back, Paul. And then, so with these few words, now I request Shobin to say a few words about the seminar. So I'll give you. Sure.
Thank you. Thank you, Professor Rajshekhar. Good morning to all of you. My name is Sobin George. I'm a co-organizer of this seminar along with others. As you know, I don't need to actually give any context to this seminar because rather your paper itself is setting the context to this seminar. You know, we are all kind of concerned on certain issues with urbanization, the rapid urbanization and urban growth that we have been seeing. And we have seen the kind of questions as researchers, as policymakers, and various stakeholders, they have been asking on this kind of issues. That is the larger context in which we actually conceived our research project. Dr. Ajay will tell you a little more about the research project that you have been doing. And this seminar, in fact, one of the outcomes of that research project, and our researchers have been working on various issues, intersectional issues of gender, disability, ageism, and health and access to labor market in different cities in India and Bangladesh, and how actually mobility infrastructure and mobility interfaces can become barriers or enables to these issues. So those are the questions we have been asking, and we have some research output that we would like to share with you. Along with that, we thought there are a lot of scholars who have been actually looking at these issues. So when we look at largely the issues of mobility research, especially the transport mobility research in urban areas, what we normally see is there is a kind of tussle between 2 major approaches. One is largely this techno-scientific or techno-capitalistic approach, and rather other side we have a kind of people-centered approach. So this when we look at the certain policies that we have seen over a period of time, like the smart city projects or the transport reform projects or the larger urbanization projects, what we have seen is a dominant knowledge paradigm, which is actually coming from the values of cost recovery. Then speed. We know we have an obsession with speed these days. We need speed railways. We need speed mobility solutions. We have an obsession with cost recovery, user fees, private-public participation, larger privatization of earlier law, because public transport, as Professor Asher has been telling, then when we were young, what we have access to is public transport. Now we see the entire transport landscape has changed over a period of time with a lot of privatization coming in. We are using paid roads. We are seeing in the transport infrastructure, which are actually not much affordable to all kind of people. So what we see is the larger knowledge background of this is coming from these values of cost realization. And it has a background because if you look at the entire literature on transport reforms in India, which is actually kind of part of our economic liberalization process, what we have seen is that more public private participation and more privatization. I'm not taking a value judgment on any of those things right now. It has both opportunities and limitations. I'm not getting into that. But we have seen is that is the predominant knowledge base in transport research. So we thought, if you look when we have such predominant research, then the focus, especially when what we see is that we don't see much place for issues of people who are like marginalized group, women, maybe people with disability, maybe people who are old, who are not very familiar with the techno-scientific kind of. I mean, probably a techno-scientific solution can give you safety, but if you are not kind of accustomed with that solution, it may be of no use to that person. So there are kind of such gaps which actually such knowledge paradigms brought into the day-to-day life in transport. There's on one side, we have those kind of solutions which are dominating our policies, transport policies and urbanization policies. And on the other side, what we have seen is that this gap and this kind of issues that people from a particular group of people, which we are actually particularly interested in this project, uh, are facing with. So this contradiction is the larger issue we have, and we have seen a very good theoretical and empirical engagement on these issues. If you look at the literature on urbanization, as such, we have seen issues like gentrification, Judith Glass, and I don't have to tell you what is gentrification. And what we have earlier, it was actually seen in the industrial cities in the 1960s, 70s, and all. But we can see such extension now here. For example, Michael Goldman, he was our VKR chair professor earlier here in ISEC. He has done a study on how actually speculative urbanization is happening with earlier rural areas with the suburbanization process, where the poor people are replaced by real estate capitalism, and how actually it can in fact change the landscape of the city and in the process displace those who are in the suburban. So this is largely nothing but gentrification. And people like Michael Goldman actually extended that logic along. He also used right to city framework developed by David Harvey. He also looked at those kind of concepts, how actually capitalism disperses certain kind of people, and in the process how spatial exclusion is happening over the cities. So we have such very important theoretical engagement. We have also seen splintering urbanism is another approach that we have certain techno scientific solutions. For example, as I said, now we have Bangalore metros, and Bangalore metro is very convenient for all of us who are actually so-called able, so-called literate, so-called technology friendly, so-called mobile. But we think it from others' perspective. Even if you have a state-of-art technological solution, it in fact delineates, actually it in fact, alienate a set of people who don't have access to it. So we have such questions, and we have theoretical models which actually engage with such questions. We have researchers have also used the framework of social exclusion. Some of our researchers in the project, we have used how social exclusion actually affecting this thing. And one of the studies in which me, Ajay, and Prajwal, we try to look at how a certain group of people, we looked at how women tuberculosis patients who are working in the informal sector. You can see the intersectionality coming in, how they are all. Women tuberculosis patients who are working in the informal sector, how transport solutions can act as barriers or enables for them to balance their different spheres of life. We looked at, because women, how they are balancing their life at family, how they are balancing their DOTS treatment, because tuberculosis has a very rigorous regimen in which you have to be there and have medicine regularly with a lot of travel. Then that same person will have to go and find work in an informal sector, which again, the precarious conditions in the informal work arrangement. So we have seen such multiple issues, and we have been grappling with this kind of question. I don't want to take much time. So what we try to look at is that the larger context of this project is, or the seminar for is this mismatch, so this gap in which we have one side a policy narrative which is dominated by techno-capitalist solutions, and on the other side we have a kind of people's need for people-centered approach. We cannot say that everything is bad, but there are a lot of efforts which are happening. We have seen a lot of activism by civil society organizations and others around mobility, transport mobility. We have seen a lot good engagement of civil society in different cities, because we have had an opportunity to work with them and how directly engaging with different stakeholders. Not like that those who are implementing are all actually, they are just not sensitive to that, because the problem, when the moment we try to engage with them, we see that they are coming forward to participate with us. So this project has particularly a kind of component of action oriented, like policy oriented approach, in which we thought that even if these are dominated by techno scientific solution, there is a space to co-create mobility solution which are more people centric. That's approach that we are actually adopting. And we have four themes here. We have it's one first theme is about gendered access to urban transport. Then we have a theme on interfaces of safety, disability, and mobility. And we have also very interesting theme on transport as cultural embedding. How in fact certain issues, because one of our projects was again on best, it's called best stories, and we try to document how people actually attribute value or create new kind of social sphere within the larger landscape of transport. How bus becomes a kind of everyday a symbol or affect. You can bring in affect theories into, and how actually it reorients their everyday life. So we have such kind of very positive and very interesting interventions on that. And we also have a session on barriers and enablers to urban transport. We have altogether we have 15 papers in the seminar, and I hope and along with that we have also seen some very interesting papers in this seminar which are actually looked at from different perspectives than what I just said. That's what the knowledge exchange that we are expecting from this seminar. We have seen people working on affect theories. We have seen people working on assemblage, how transport is an urban assemblage. This is very interesting thing. We have seen how people like alternative method of transport, like water transport. We have seen such kind of papers. When you look at the program, you will get to know. And we think that we will have a very fruitful discussion and exchange so that we can actually go ahead. Along with that, we also have a very interesting thematic roundtable, which is on decolonizing urban research, art for decolonizing urban research. And we welcome all of you to participate in that. And let's, this also looking for future collaboration and future to develop future areas of work. With this background, I join our director to welcome all of you again and hope you will have a fruitful discussion here. And thank you very much again, taking all the pain to come all this over this distance and be with us. Thank you very much.
Thank you, Sobin. May I now request Ajay to deliver his keynote address.
Thank you, Professor Rajshekhar, for hosting us, for inviting us back home. Very happy to be here, and also very grateful to Sobin, Lekha, and Pajwal for organizing this seminar. My keynote today would focus on equitable access to public transport in urban environments. So, but not so much as a keynote in a sense of introducing a whole new topic, but kind of sharing with you all of what we have learned in this project in the last 3 years, and where do we go, where do we find these gaps, and how can we go further with that, right? So to begin with, yeah, these are our key objectives of our research. So each of our PhD or postdoc projects explores one or two of these elements. So it comes back into understanding physical and social barriers to urban transport, the socioeconomic implications of these things, developing and contextualizing measures to improve access. Because technically, we are not transport researchers, right? So we are people working on aging, working on migration, on gender. We're anthropologists or sociologists or economists in that sense. So we are not transport engineers. For us, transport is a means to accessing work, accessing healthcare, accessing social life. So we want to understand what are these measures that can be employed to improve access to these three elements. To especially if you take, for example, the case of older adults, to reduce loneliness, to reduce issues around lack of access to healthcare. We've seen in many of our projects is that it's not that the older adults do not know that they need to go to a healthcare institution. They just cannot get there because there's no one to take them there. Or they fear getting onto a bus for the fear of a fall, or they've fallen before, or they've heard other older adults who have fallen while getting onto a bus. So hence they are more reluctant. Any delay in further accessing healthcare further complicates the situation. And we have to think of comorbidities such in terms of diabetes, hypertension, and these kind of things, which further get complicated because of not timely access to healthcare, right? So in our project, we look at door-to-door mobility. So it's not just the bus, the metro, or the train. It's like from the moment, not even before stepping out of the threshold, how do women, older adults, and people with disability already start planning of how do I negotiate the urban space before I even start thinking about stepping out of my threshold. Yeah. And the costs that are involved, both emotional costs, but also economic costs involved in everyday negotiations of this urban space. Yeah. We take motility as one of the elements. We look at the competence in accessing different forms of mobility, but also appropriation of mobility by the. So it's not that there is the metro, then everybody can use it. There is a metro, but every individual has differential access to it, depending on their person's ability to appropriate that mobility and the individual context in which that person is living. Think, for example, someone who's on a wheelchair. The metro is a perfect location in terms of there is the lift, it will take you down. They'll also give you special attention when they're checking for security and all of that. But getting to the metro station is already a problem. Like if you have to go and there is such big a gap between the road and the footpath, who's going to hoist you up onto the footpath? So when we think about infrastructures, it's not just the infrastructure that is available, but how do you do these shifts, these intermodal shifts between different transport infrastructures? And those gaps actually reduce accessibility. We take these 4 A's, which many of you may also know about: access, availability, affordability, and acceptability. And we critically examine these individual concepts in relation to these particular groups. And we take intersectionality as an element because we don't look at only women or only older adults or only disabled. For example, an older woman with some amount of disability coming from a low economic background or an informal settlement will face many more hurdles in accessing public transport as opposed to looking only at older adults or only at. So this intersectional lens has actually helped us bring more nuance into our analysis, is to understand where are these intersectional inequalities intersecting. And this is not only for transport, this is in general for other social positions as well, that relate to access to work, access to financial services, access to basic human rights to a large extent as well. How that kind of gets complicated due to this non-recognition of this intersectional lens. Some of the key findings which we saw, and if you recognize this pictures also from one of us sites, things from Prajwal, right? You took this picture. We talk about ageist infrastructures, or is it about behaviors? It's not either or, it's both. It's the infrastructure sometimes is not adapted to older adults accessing the services, but also people within these infrastructures, their behaviors towards the older adults also affects these things. So chaotic urban transport planning, that is this non-ability to move between different transport options, already creates this infrastructure that limits people's access to services. The second is there is no focus on people with mild disability or for lifelong access. In a sense, the general picture of someone who is disabled is someone who's in a wheelchair. But what we see with older adults is it's like walking slowly or having sight related issues or having being anxious or jittery, or all these elements are all mild disabilities which affect access to transport. So we should think about how do infrastructures also take into account this kind of lifelong access, that the person doesn't remain in one condition, right? All of us age, all of us change in our access to it. So how do infrastructures also take in this kind of lifelong element into account? Less attention to the needs of the passenger, but more on access of providing that they're getting as many people into the bus or into the metro in that sense. In some places, in some metros, like for example, in Delhi metro, they have these marks that guide people to different lines, which is interesting. It is kind of nudging people to take certain action, but not in all places. Yeah. What we find more, Professor, when that comes in terms of ageist or ageism, is the abusive behavior and ageist remarks. In some cases, it's turned as, oh, that's a very cultural thing to do, and that's not just in India. We have also seen this in Salim's work in Dhaka, for example. And you think that, oh, it's just a remark; it shouldn't affect people. It does on an everyday basis. If people have to face harassment on these things, on one fine day, that person will start to think, why should I do this? Take this trouble. I've had enough of it, right? Or that the everyday experience of othering or discrimination also has an impact on this group of people. Theft, fear of accidents, and aggression on the streets are other elements where these ageist infrastructures and people as being part of those infrastructures also limit access to services. Uh, there are multiple challenges in what I also discussed, and this is from a visual survey that was conducted. Transfer between transport options is limited. First and last mile connectivity hinders access to transport. Everyone thinks about only the transport infrastructure, but getting from their home to the nearest infrastructure is already difficult. If the lights don't work, for example, we saw in the research in Delhi, or the work from Sangamitra in Kolkata, is that the lighting plays such a big role in the evenings. The metro is very well lit. The minute you step out of the metro station, it's dark. There are a group of men standing in the corner over there. You have to negotiate, take a longer route to get to your home, or find longer routes where the lights, street lights are working. So all these elements add extra pressure on women in accessing transport. You know, it's not that then they have to limit, and we've seen this more in our studies, is that for younger women, they would opt to go to colleges closer by to their homes where there is shorter travel distance. Not that those colleges are good, it's because it's considered that I can come back home within a safe time. Yeah, thus limiting their human capital, accessing work, or getting better education. Yeah. In relation to older adults, the risk of fall or a road accident is very high. And what we see is that the lack of footpaths, or so many people on the footpath earning their livelihoods, is that there is no space to walk. And most often they walk on the streets, which risks that they are hit by a two-wheeler or they have a fall due to the crowdedness. So these precarious road crossings and those kind of things also impinge their ability to engage. Yeah. As people age, their geographies also get smaller and smaller. And then with these kind of challenges, it becomes even more difficult for them to access urban space. The other element, and that's something we also talk about in the global south context, when we talk about aging and retirement, I mean, like, who's going, a large part of our work, and Sobin's been working on this, is in the informal sector. They don't have the luxury of retirement. You know, they have to work. They work beyond the 60 plus. When we work with older adults, they say, I have to work till I till I'm able to work. Yeah, I have to support my family. In some cases, I have to support myself and my wife because my children have left or they've gone somewhere else. So large groups in the informal sector who are like this rickshaw driver or other people accessing services, for them, it is lack of access to good transport affects their earnings, also affects their ability to negotiate access. What we've seen in our work is women are more disadvantaged and have to seek work for survival because one, they have women have less lifelong savings because of non-access to work. Second, are either abandoned or they have to move away with the loss of the spouse or death of the spouse. They have to move further away to live closer to children, and hence they have to travel larger distance to access work. And that's this intersectional analysis that we find in a sense of it's not just about gender or about economic level, it's also about the patriarchal structure in which women have to operate to access work. to access healthcare, to negotiate access to even social life for a large extent, like going to weddings or marriages or family functions, is not so easier for older women who have to depend on other people to get them to these places. Um, Adapting livelihood to travel distances, it's not, so leads to lower wages in that sense that it's a bit of a cost benefit analysis. I can travel larger distance, but then I have to pay more fares. So I'll go to a nearby place which offers me lower wages, and then I can still manage to live with that low wages. So yeah, those are kind of considerations that people actually should not be able to. It's a right for people to have transport. The impact on health and security is the high cost of traveling, compromised access to care and treatment, because then instead of going to the big hospital, they'll go to the quack nearby or to the non-licensed practitioner nearby. Delay in accessing care leads to worse outcomes. So, and this is not just in lower socioeconomic groups. In the aging and well-being study that we did, we saw this also in middle income or slightly higher middle income groups with children living abroad. And as the thing that the older people knew they had to go to. They had a very expensive car which their son had bought them from the US and everything, but there was no driver to take. So when we think about access and affordability, there affordability is there, and availability is also there, but access is not there. There is no one to take them to those particular things. And what we've seen recently with the work that Divya has conducted in Bangalore is this medical infrastructures extend beyond the hospital. So you may get to the hospital, but getting into the hospital and walking to the larger distances to get to the OPD, for example, when you don't have these services in well-off hospitals, I think in one of these Netralaya or so these big eye hospitals, they have these golf carts that they take people around for those things. But most government hospitals or they don't have these services. So people with some amount of mobility issues or walking issues, they can hardly reach the OPD sections. So that not just about transport as modes in which people have to get there, but even walkability is increasingly threatened. Walkability is threatened both in terms of access to these facilities, but also walkability within the neighborhoods. There may be a very good park, walking park close to your home, but getting to that park you have to cross roads to get there. That may be more precarious than getting to that particular or having that walkability within those parks. So what I want to come towards the end is the long-term impact. So one of the critiques I have of this whole transport related or mobility related research is it's very much looks at a cross-sectional perspective, where like at this moment what is happening, and then what can be done. But that's a bit of a short-sightedness, I would say. I think we need to take a more life course perspective to see what has happened in the past and how does that impact current behaviors. So this lifelong impact of abuse, harassment in public places has an impact on how people experience these spaces in later lives. It's the social, psychological, and both the economic impact of those things. So when we think about transport inequalities, it's not just about increasing fares or reducing fares. It's about taking this life course perspective to look at how do people over a period of time have been affected by this, and how their current behavior is a reflection back on these inequalities and abuses and harassment that they have faced in the past. So loss of dignity across various intersectional groups has a greater impact in access than just focusing on affordability. I think we need to move beyond this focus on affordability to look at how to strengthen transport from a more rights perspective and bringing back this dignity across the different intersectional groups. Okay, that's my last slide. Oh yeah, this I made some of these points earlier as well. Involving stakeholders earlier in the process, refocusing on the public in public transport and not just the buses. What through all our data collection across these cities, what we realize is that transport inequity opens doors to understand other hidden disadvantages, other social inequalities within the household that was not our primary purpose to look at, but qualitative data really shows us all these different hidden disadvantages that impact access to transport, access to work, access to healthcare and social life. I'll stop there. I think I've overtaken my time. Please, this is our website. You can follow for input, and we are hashtagging inclusive mobilities today. So if you're tweeting, you could use that hashtag. Thank you.
Good, good. So let's give him a round of applause. Very good. Though you summarized what emerges from your research, but the longer impact of this research, the inequality in the transport, I think that's quite interesting, and that which only means that we need to continue to work on some of these areas to look at in the longer term what will be the impact on different sections, so the elderly, and then different caste groups and different economic groups. I think that's quite interesting, and then we are particularly happy to listen to you, Ajay. Thank you very much for delivering this keynote. And then let me now move on to Prajwal to give thanks to us. So then we can break for tea.
Thank you, sir. So many hands have coordinated in a rather quick time to organize the seminar. Also, it's my duty to propose a vote of thanks for all of them. So firstly, we would like to thank the hosting institution, Institute for Social and Economic Change, for offering all the facilities and the services for the seminar to happen. And particularly, would like to thank the different departments at ISEC, more specifically the CSSCD and Shailaja ma'am and administrative staff, technical assistants, and the finance department over here. We would like to especially thank the funders for their assistance, the Dutch Research Council, NWO Votro, and also the Utrecht University for their funding. And I'd like to thank Professor Rajshekhar, Director of the Institute, for the very encouraging remarks and for inaugurating the session. And I'd also like to thank Dr. Sobin George, co-PI on the ICMO project, for both introducing the seminar and for the constant support in organizing the event. And I'd also like to thank Professor Ajay Bailey for expanding on the research outputs of the ICMO project and for the very insightful keynote message over there. And most importantly, I think the ICMO colleagues, the PhDs and the postdocs, who are all in different continents currently, but still coordinating and putting up the show together. Thank you all of them. And I also like to take this opportunity to thank all the paper presenters who traveled from different parts of the country, and also the chairpersons who would be going over different sessions for the next 2 days. And we are very much excited to witness all the different research insights that you have carried from different parts of the country. And we are very sure that it's going to be an engaging 5 sessions for the next 2 days. So from my end, I think also like to thank Lekha ma'am, who's also there. And I'm sure all of us are going to have a very engaging seminar. So before we begin with the first session of the day, we're going to have a short tea break for 10 minutes, after which we're going to start with the first session, which is looking at gendered access to urban transport, which will be chaired by Professor Sangamitra Roy. And I hope all of you have a very fruitful 2 days of seminar. Thank you.
Thank you, Prajwal, for the offering thanks to all of us. And then let's now break for tea. And then I think we almost we're keeping up to time. And then we'll come back by 11 o'clock. Okay, let's go for tea.
Hello, check, check.
Hello, everyone. I'm Shanghamitra Roy. A very good morning to all of you and a warm welcome to session one. I will be chairing session one on gendered access to urban transport. And in this session, we have four very interesting presentations that talk about women's everyday mobility, accessibility, and then women's safety, as well as adaptive behavior of women. This session will be for 2 hours. First, we will have all the presentations. Each speaker will have about 15 minutes to present their papers. I request all speakers to, please take care of that. After that, we will have the question answer session and discussions after all the presentations are over. So we look forward to the presentations and discussions and learnings. So with this, I now request our first speaker, Miss Fatima Zeba. She is from Calicut, NIT Calicut. She will be presenting on women's mobility and access to cities, a study of domestic workers' everyday mobility in Kochi, Kerala. This paper is co-authored by Dr. Mohammad Firoz and Dr. Lakshmi Priya Rajendran. Over to you, Ms. Fatima.
Thank you, Ms. Roy. Good morning, everyone. First of all, thank you, Project Diploma Bank, ISEC, for this great opportunity. Yeah, okay. Okay. But no, that I'm. So, my name is Fatima Zeba. I'm an architect planner and currently doing my PhD in National Institute of Technology, Calicut. I'm under the guidance of Dr. Mohammad Firoz and Dr. Lakshmi Priya Rajendran. So today I'm here to present my work on women's mobility and access to cities, a study of domestic workers' everyday mobility in Kochi city, Kerala. So this is basically part of my PhD work. And right now I'm in the stage of data collection only. So I don't have a lot of analysis to show you, but whatever I have understood from whatever I have read and seen, and when I talk to people, I'll present there and I shall receive valuable comments from you. So I'll give you an introduction, then introduce my problem, and then show some results. And then I can. So. So, like we already discussed about urbanization, urbanization has already had a great impact on people's quality of life. It should actually reflect on people's quality of life positively in all genders, so that we can achieve gender equality as per SDG 5, Sustainable Development Goal 5. But then, though urban women have more opportunities when compared to their rural counterparts, because they have more access to job opportunities, they have more access to education services and all. But then, urban women, when compared to urban men, are less benefited from urbanization. So globally, if you look at the statistics, even in the countries where women earn very high, the gender disparity in their per capita income is very evident, and our gender inequality index also shows a very high disparity around the world, especially in developing and underdeveloped countries. So, what is the relationship between women's quality of life and their access to city? So, women's quality of life depends on their access to several services that is offered by the city, which includes housing, the basic services, social and civic infrastructure, transportation, and mobility. So, here I would like to define or operational give an operational definition of access in my research context as a capacity or ability of an individual to take part in a set of activities which is required to maintain a better quality of life. So, what is the connection between access and mobility? Uh, Researchers have always identified access as a function of one's mobility of an individual, and also studies show that among urban women, informal working women are the most disadvantaged in terms of accessing the city. So because of course, obviously, because of their lower socioeconomic status and lower educational attainment. So what are the gendered patterns that we see in mobility of women? So women, we have evidences that show women make more complex journeys than men. They often travel to work uh, along with their travel for childcare, to school, to take older adults to healthcare, etc. And yeah, and 75% of bus journeys are undertaken by women, but only 1/3 of women have an access to a private car during daytime. So what are the key challenges? The first and foremost challenge is, of course, violence in public spaces. So what happens with violence is that it will restrict them in accessing the resources and job opportunities, which in turn will lower their rate of female work participation. And also in terms of governance, inadequate representation of women in governance structure will result in the limited women's engagement in urban governance. Also inadequate housing and land rights. This is in terms of spatial planning and urban planning. So these inadequate policies or practices can constrain their decision-making power, and it will interrupt their equal participation. So along with that, there are studies proving that women feel less safe when it is darker. Then also poorly considered land use policies, like land use zoning policies, which actually separates their housing housing places from their work. You have a different, they have to travel a lot, and that actually impacts their mobility. So also poor public transport and lack of caring facilities which is near to their place of living, which also affect their access to labor market. So what has been done until now in literature, I have tried to study that and find out the gap in the research. So initially I did a bibliometric analysis of the literature, which actually touches upon how research on this topic has evolved and how it is structured and all. So I had applied a particular search strategy, which is written here, and finally selected 323 articles, which actually talks about this topic and related subtopics. So I'll give you a glimpse of some of the results that I have found out. So this is a network analysis, which actually it's a co-occurrence of keywords is what you see in this picture in this network, where you can see 3 clusters, one in blue, green, and red. So the largest cluster or the central cluster is centered around the term accessibility. So another factorial analysis structure map also shows accessibility as a major cluster. So inside accessibility cluster, we have the topics very prominently that gender, women, etc. are some of the major keywords that is included in this cluster. So based on that, I have read more and selected 44 articles for a detailed content analysis. And then I have identified 4 themes, out of which 50% of the work was under the theme accessibility and its associations, like its association with social factors, spatial factors, technical factors, etc. And what and whom have been studied. There are studies with which talks about job accessibility, food accessibility, healthcare accessibility, and researchers have focused on women different income groups, older adults on a broader, very broader approach. So this case, coming to the case, I've selected Kochi city in Ernakulam district in Kerala as the case study. So Kerala stands first in the Niti Aayog SDG index, which is attributed to its higher performance in educational attainment and providing good health and gender equality measures that the state has adopted. And Kochi is considered as the industrial and commercial capital of Kerala, and it is supposedly to be the topmost developed city in Kerala. And if you look at the map, we have a mainland and some suburbs, which are actually islands. So the mainland is the most developed, and people travel from these suburbs towards mainland on a daily basis. So regarding workers' mobility in Kochi, a study in 2010 has shown that they have classified actually workers in five categories: that IT professionals, construction workers, office staff, domestic workers, and retail workers. So what I found out from the study is that 100% of the domestic workers category were female, and they had the lowest average income, and 96% of them use the public transport. It might be bus, or they even use water transport to reach the city from the island. Also, interestingly, they had the lowest the shortest distance to cover to their work, but they took the longest time to cover that distance. So that is something that struck me. And also, there are a few things that they have found out because they travel daily to the main city because of availability of work there. But domestic workers in particular, they were not willing to do the supposedly low profile job, which they consider as a low profile. They were not willing to do in their hometown, and they wanted to travel on a daily basis. Even if they get a job, the same job, they don't want to do it, where they will be people around them or from the family will be knowing that they are doing this job. Now, some of the initiatives that Kochi has taken as a gender sensitive thing is there is already have been happening, and there is street taxi, there is appointment of women employees in metros, Kochi Metro, other public transport, etc. A lot of things are happening there. But still, are then women's mobility issues resolved yet? So a recent study by GIZ into 2021 actually got more details about what are the issues that women face in the city in their mobility. So of course, harassment is a major thing, and majority of the respondents, they faced harassment while traveling, whether it be visual or verbal or stalking or groping or flashing, anything. And many of them, only 10% of them were responding to this harassment because of, several reasons. They didn't want to get involved into difficult process or involved in legal, filing a complaint. It's difficult for them to do. Also, there are other issues in terms of the infrastructure, like issues with crew conduct, uncomfortable bus stop design, non-maintained facilities, poor bus design, and inadequate street lighting. Also, some factors which affect women's safety are the absence of a woman's perspective in the design of the infrastructure. Also, deserted streets, crowded buses. So all these were the problems identified by this particular study. So my research problem, I present the questions that I would like to address. First question is, what are the various socio-spatial factors that affect the everyday mobility of female domestic workers in cities? Second is, what are the patterns? Yeah. What are the patterns female domestic workers that affect their mobility, and how do these factors affect is related to their access to city? So this is the overall research design. I will not go in detail. So first, there are 3 questions that I want to address. And the first will be the identification of these factors. Second will be prioritization of these factors. So this part will be qualitative, and the next phase will be a quantitative study. So it's a mixed method, exploratory research design. So to identify the factors, I relied on literature itself. I did a systematic literature review in which I selected the articles in a systematic way, and finally arrived at 35 number of factors affecting women's mobility. So, and I applied by applying several inclusion and exclusion criteria. So these are the factors which I have identified from the literature as the factors that affect women's mobility. And I have categorized them as physical, social, economic, emotional, spatial, then personal and institutional. And then I did a a few in-depth interviews and 2 focus group discussion, which right now I'm actually continuing that data collection part. So yeah, this is the sampling strategy and recruitment strategy that I have adopted. So afterwards, I conducted a thematic content analysis where I have developed a few codes, which was later on developed as themes. And what I found out is basically this. So these were the themes I identified. Under personal, you have physical difficulties, income, number of children. All these affect their mobility. All these affect their decisions in mode choice, the job choice, etc. So whatever is marked in red is actually the new themes that was emerged from the discussion. The rest was actually informed by the literature. I have actually done a deductive coding where I already have a set of factors with me. Then I try to relate, try to pick those codes that I have identified from the discussion to the already existing things. So some of the new things were really interesting, actually, that will be summarized in this code cloud, where this is basically the, so all these terms, all these words represent the themes, and the size of the word actually is based on the frequency of its appearance. So you can see fear of crime and harassment, financial status, care work responsibility, norms and beliefs, all these have the very prominent codes. And norms and beliefs were especially very prominent because this is what I found out from my study. There were a lot of layers of, their social background, their cultural background, their customs, their beliefs, religious beliefs, their superstitions. Everything was, so much attached to their decisions in mobility. So, for example, if I want to take quote an example, most of them didn't want to come late. They wanted to reach before dark and light the diya during sunset. There's a practice. Yeah. So those kind of norms were existing. So some other key findings were, of course, fear of darkness. And even while traveling in familiar place, if it is dark, they are, of course, they will not choose that path. Then other important thing is gender dynamics in household. Most of the participants identify their travel pattern very different from their spouses or their son's travel pattern, because they don't have to do anything. They are always served. Men are more privileged in the household. For a lady to, yeah. So,
I'll request you to
yeah.
stop the presentation. The time is up.
Sure. So it's all over. Yeah.
Thank you, Ms. Fatima. Thank you so much for the interesting work in the context of
Thank
Kochi. May I now request our next speaker, Dr. Sharmin Nasreen, to give the presentation. Dr. Sharmin Nasreen is from the University of Asia Pacific in Bangladesh, and she will be presenting on exploring transport mobility issues and adaptive behavior of women in a developing country. And this paper is co-authored by Dr. Subha Chowdhury, who is from University of Auckland, New Zealand, and also Miss Noor Jahan Happy. She is also from University of Asia Pacific, Bangladesh. So over to you, Dr. Sharmin. Dr. Sharmin, you are muted. Can you please unmute yourself?
Can you hear me now?
Yes, yes, absolutely. Thank you.
Okay, sorry about that. I haven't noticed. So Thank you so much for giving me the opportunity to talk about our paper title, Exploring Transport Mobility Issues and Adaptive Behavior of Women in Developing Country. So this paper is authored by Dr. Sube Chaudhary and also Nurjahan Happy. Dr. Sube Chaudhary is the senior lecturer in University of Auckland, and Nurjahan Happy, she's a graduate student in University of Asia Pacific, Department of Civil Engineering Department. So first, I would like to talk about the background of the project. That the transport system in developing countries, in most of the developed countries, include actually both formal and informal modes. And the case study area of this paper is Dhaka, which is the capital of Bangladesh, which is also not very different from that. So inefficient and urban public transport system impose greater restriction on women's mobility. Dhaka also has the same kind of characteristic. So most of the time in the daily commuting time, they actually encounter confrontational and non-confrontational harassment. So even though actually in Bangladesh, 50% of the population are women and 45% of the population represent total working age population. And among the employees, which is the main income generating industry in Bangladesh, that is garment factories, around 85% of workers are women. So not only in garment factories, women are also involved in other sectors such as agriculture, manufacture, construction, and other service-oriented job, etc. So, however, even though women are they are working, but still they are facing a lot of issues while commuting. So by Bragg study in 2018, it says that 94% of women who commute by public transport have experienced sexual harassment in verbal, physical, and or in other form. And while 26% were harassed on streets and 82% experienced leering by men. Actually, to protect them, 25% of women commit to stop using public transport, and 45% started wearing hijab, which is Muslim headscarf, to appear less attractive to men. However, in the same study, actually, it says that it doesn't, even though they are changing their appearance or they're changing their dress, it's not not much the attitude of men is changing. Because of cultural attitude, most of the time, women also, they cannot defend themselves from misbehavior or physical touching on public transport. So to achieve economic and social development, it is important to understand the transport mobility issues of women. And another thing is that Bangladesh is actually committed to achieve United Nations Sustainable Development Goal. In the Goal 5, it says that to end all form of discrimination against all women and girls everywhere, and also eliminate all forms of violence against all women and girls and in the public and private spheres. To achieve this goal, actually, we have to have sustainable transport system and we have to address all the mobility issues of women. Even though, fortunately, Bangladesh socio-cultural constraints on women's mobility have decreased over time, with more women attaining paid work, but transport mobility is a constraint they are still facing. So to understand the mobility issues of human, we have to understand the mobility issues of human to implement sustainable transport system. So this present study actually examines similarities and differences in women's mobility across all income groups. Many studies have conducted gender mobility issues, but there are very not lot studies, not very that actually address the women's mobility across all income groups. So the research question that that has been addressed by this paper are: what are the mobility issues of female commuters from all income groups? How are women across all income groups adapting and meeting their mobility needs? So the methodological approach that has been adapted by this research is data collection. So two types of data collection has been conducted. One is focus group discussion and another is travel survey. Actually, travel survey is rival preference, which actually ask about that actual daily traffic, how they are commuting. So qualitative second step is a qualitative analysis of focus group discussion, and the third one is multinomial logic model. So it can be seen that this study is also like a combination of qualitative and quantitative analysis. So multinomial logic model is mathematical model which has been done by the LIMDEP software. So in the focus group discussion, actually, it has been conducted by 3 income level. So group 1 is mainly included lower middle income, which comprise 0 to 30,000 taka or Bangladesh currency per month. Group 2 is included middle income, that is 30,000 to 60,000 taka per month, and high income is above 60,000 taka per month. And group 3 actually involve non-working female commuters. So in the group 1, it has been conducted at the school building of Islam, which is informal settlement located in Mohakhali, Dhaka. Total 60 of women participated in this group, and they are actually comprised of domestic worker and garments factory worker. So this group is also divided into 2 subgroups, each with 30 participants. One group is with the domestic worker and another with garments factory worker. So average income on this group was between 5,000 to 50,000 BDT per month. So age mainly actually ranges from 80 to 50 years. This women actually because they are from the mainly those who are from low income background, they actually walk to their workplace, and those who are, even though in the lower income range, the higher boundary of the lower income range, they actually sometimes take for commuting to longer distance, they take paratransit, such as that is called Laguna in Bangladesh. So group 2 is conducted at the Asia Pacific University campus. The age of the participant varies from 25 to 50 years. So mainly 25 women participate in this category. Most of the women in this category they worked in private companies or different government organization. So they are also main purpose of travel in a week is work. Participant in this category use different types of modes based on their affordability, actually, and also the distance, such as rickshaw, bus, cars, shared rides such as Uber. Patha is a local shared ride company. Auto rickshaw, that is locally called CNG because it is driven by CNG, and some also walk, those who live very near to their workplace. And group 3 is also conducted at the Asia Pacific University campus. 25 women participate in this category. Their family income was above 30,000 taka. Most of actually they are non-working, so their family income was asked how much their partner or their family members are earning. Most of them are housewife or students. The main purpose of the travel included shopping or education trip, and education trip also actually divided into two category. One is those who are students, they are traveling to their education institution, and mother accompanied by children. So that is also actually categorized as education trip because they are escorting their children to the school or college. So participants use different types of modes such as rickshaw, bus, car, shared ride, or auto rickshaw, and sambar. So the travel survey that was mainly paper and pencil based survey because that is actually more easier in considering like Dhaka's situation. So divided into two sections. One is first one is demographic. In the demographic section, they were asked about their age, income category, their marital status, they have whether they have dependent or no dependent, they have car availability or no car availability. And the second one, second section contained travel related question. So data was collected between February 2009 to June 2009. So the respondent were selected by 3 steps of random cluster sampling. So for that, actually first step in the among the 3 steps, first step Dhaka was divided into 8 zones to attain responses that are representative of Dhaka's population. So sorry. So this is the map of the Dhaka. So Dhaka was divided into 8 different zones to cover to get the sample as representative as possible to the population, population of the Dhaka. So second step, employment center, shopping center, educational institutions, and informal settlement were selected randomly from each of these 8 zones. In the third step, actually, respondents randomly were selected. So total, altogether, 2,000 women participated in the survey, and each survey took approximately 10 minutes of the time. So this is the sample of the travel survey they were asked. So in the travel survey data characteristic, it says that most of the women are from 19 to 60 years range, even though it says 0 to 18, but actually most of the women are from 15 to 18 categories. So 0 to 18 has been chosen because some of the garments worker actually start working at very early age. So even though they are they are below 18 years, they have been asked about the travel characteristics. So income, most of the about same 0 to 30,000 and 30,000 to 60,000 percentage. So marital status and trip purpose, and this table actually says the modal characteristic of different income category people. So we can see that most of the low income actually they are walking to their workplace or their destination, and middle income the only 28%, and very actually very insignificant percentage of high income women they are working. So rickshaw also, most of the middle income earner are the user of rickshaw. And Laguna or paratransit, that is actually kind of covered minivan. So most of the low income people are actually mainly low income people are the user of this. And auto rickshaw is about same. So bus bus mainly middle income people, and some high income people also, high income women also actually they are taking bus to meet the transport requirement. So in the result from the focus group discussion, it can be seen that they are actually mainly walking. They mostly don't have any alternative to walking. So after walking long distance, it has impact on their physical and mental health, because physical, of course, it is very exhausting sometimes, and mental health because sometimes they actually they can't give much time to, after working to long hour, they can't give much time to their family or to for their own. They don't have any much time for their own. So another thing is waterlogging. Waterlogging is a serious issue faced by low income women, especially those who live informal settlement, because they have to work, and they can't afford to take any other modes such as rickshaw. And another thing is that inside informal settlement, actually rickshaw also can be travel. So sometimes they are walking on pool water. It causes food infection. So and also some of the women in this category, they try to go back to their home before it is night, but sometimes because of overtime, especially the garments worker, they have to work at night, and they walk in while traveling. They walk in a group, or they share their rickshaw cost, or even sometimes they that's why the CNG mode share is higher for low income, because sometimes they actually travel by CNG or auto rickshaw, and they share the cost. They have concern of safety, especially when they travel outside of their informal settlement. Because especially at night, that is also harassment, also like hijacking, different type of issue. So group 2 is middle and high income. So most participants travel short distance and they actually take rickshaw. For long distance, middle income commuters from this group travel commonly by bus.
May I request you to please conclude now?
Sorry.
May I request you to please conclude now? The time is up.
Oh, okay. Okay, that's fine. Okay. Okay, thank you so much.
No, you can conclude, ma'am.
Okay. I can continue.
You can share your conclusions, briefly.
Okay.
Because the time
Sorry,
is up.
Okay.
Thank you.
Okay. Actually after this focus group discussion in the multinomial logic model, some factors have come up after different trial. So this is the model result. So model result shows different variable, their importance and their positive and negative effect. So in the conclusion, because I have less time, I don't have time, so I just tell the conclusion. So women are actually after focus group discussion and mathematical model result, it shows that they are actually vulnerable irrespective of their income and social status. So preference for different modes also varies with the income and social status of women. So we have seen that more choice actually percentage has varies with the income level. So most vulnerable are the low-income women, because despite their direct contribution of the country's economy, they do not benefit from the transport system. They often need to walk due to being unable to afford motorized modes and live in neighborhoods with the proper transport facilities. Facing verbal and physical harassment is common for middle income, even low-income people who are the user of public transport, and also those who walk. High income women who drove their own car, even though it is not very common in Dhaka, very insignificant percentage of women drive their own car. They actually face verbal abuse. So it is not socially very much accepted. And also from the discussion, it is known that harassment is an issue, but mathematical model shows that even though they are facing different type of harassment while traveling public transport or while walking on road, they can't actually, they can't actually shift to any other mode, because they have to travel, because most of them are working, and even though they are facing verbal or physical harassment, they are working, or they are taking different type of public transport such as bus or Laguna or CNG. So they can't and many type of issues are actually occurring because of those harassment. So some of the recommendation: provide education and mass awareness about negative impact of misbehavior or unwanted physical contact, enforce respect for women commenters, engaging police at all bus stop, implementing mobile phone app for women in case they need help button inside public transport and at bus stop directly linked with enforcing authority, ensure affordable housing and subsidized public transport for low-income women. Low-income housing along with the periphery of Dhaka and subsidized public transport can improve the living standard and mobility of women. So improve infrastructure such as providing walkway, cycleway, and also like encouraging women to cycling, because it's very rare even for women to cycle in Dhaka. So implement policy to organize the presence of vendors on sidewalks. So vendor presence, they want vendors, but of course organized way of vendors, because they think that the presence of vendors will provide them extra safety on road. Different organizers and factory owners can implement transport service for night shifts to help women workers reach home safely. Especially garment workers can organize transport for their workers to reach their home. So yeah, that's all. Thank you so much, and sorry for taking the little bit extra time.
Thank you, Dr. Sharmin. Thank you for the insights on these two population groups that you have worked on.
Thank you.
Now I request our next speaker, Ms. Seema Mori from Utrecht University, to present her work on affect and assemblage of safety, unpacking everyday aggressions of public transport in Dhaka. This paper is co-authored with Professor Dr. Ajay Bailey from Utrecht University. Over to you, Ms. Mori.
Thank you so much. Good morning, everyone. Let me just share. All visible?
Yes, it's visible.
Okay,
There
perfect.
is a little bit of echo.
Is it better now? I hear the static. It's probably to do with the mobile device somewhere. You know that static that usually plays. Is it better now?
It is. It is. I'll let you know in case it becomes more.
Okay. Yeah. Great. Thank you for the opportunity to present online. I understand most of my colleagues are there in person, so I appreciate this a special allowance to present online. My name is Seema Mori, and I am a PhD researcher at Utrecht University. I've been working with Professor Bailey as my supervisor, and the focus of my PhD is on women's safety in public mobility infrastructures in Dhaka. But today I'd like to present my work on effects and assemblages of embodied experiences of mobility, you know, the daily negotiation of safety for vulnerable communities of Dhaka. So some of the speakers before me have already alluded to sexual harassment and the presence of harassment on the streets of Dhaka. And I just want to go a little more granular on that topic. But before I proceed with the presentation, I want to pause and kind of explain what I mean, because I'll be referring to the word effects quite a lot. And if I can use the example of the Iranian Revolution that's been unfolding, right? You've all seen those videos and pictures of people's uprising. You know, there's this video of the dancing bodies without the hijab, protesters burning hijab, cutting off hair, or take any revolution for that matter. You know, that you understand that these revolutions are a power of effective flows, right? They're charged with these with a sense of danger and promise, and there's hope and threat. And there's, you know, and it doesn't really happen overnight, but there's this long simmering anger and frustration over restrictions of, you know, maybe personal freedom or injustice that has the power to sort of unite people across class, race, age, and gender. But that's at a macro level. But if you also want to go micro, think about the atmosphere of a room before a meeting or before this conference. You know, think about the atmosphere in a place of worship, or the atmosphere that surrounds the Queen's death during the royal funeral. You don't see it as much, but it kind of envelopes and you know, sort of presses down on society from all directions with a certain force. And that's precisely what I mean when I say effects, right? It's unconscious, and it's sort of in between feelings, and it has this power to kind of search through bodies, quite different from feelings, which are more experienced at a bodily level, and it has a conscious reaction, right? So what I argue with this paper is that everyday spaces of public transportation, it's wrapped in power and privilege through these bodily or corporeal encounters. And so using theories of assemblage thinking and effects, I kind of explore how these effects work to shape individual and collective bodies, you know, and their agency in public transport. So keeping that in mind, I set out with 3 objectives for this paper.
Mori,
Yes.
Can you please check if your phone is on silent mode?
It is.
Okay. If you can please keep it away from you, we are hearing some disturbances.
I hear that too. Yeah. Okay.
Thanks.
So with the three objectives that I had for this paper, I wanted to understand effective atmospheres that explore the commonplace relations that female commuters are sort of immersed in everyday journeys. B, I wanted to explore how these effects territorialize. By territorialize, I kind of mean that they combine and coalesce over time. So that creates these assemblages of safety or unsafety. And then three, I wanted to look at what individual actions have the power to deterritorialize these assemblages. So it can kind of deconstruct the assemblage of safety. I do so using a qualitative approach. So I've conducted about 30 qualitative interviews within the ages of 20 to 61. I also conducted visual behavior mapping in busy bus stands, footover bridges, and intersections. Some of the questions that I asked during the interviews had mostly to do with their experiences of public, using public transport, of course, but also more specifically on the incidences of harassment that they faced, how it made them feel immediately at that moment, how they reacted to it, and also how they reflected back on them. And I'll share the findings in a bit. You still hear the static, because I do. Okay. For this visual account that I've created, I've combined three of my participant interviews to illustrate a working woman's commute to work. In the figure, if you see this, I don't need you to read all the text, so don't bother. I know it's too small, but if you can just focus on the red bolded parts of this visual. What I really wanted to show here was this how an average working commuter would usually take rickshaw for the first mile activity, so from home to the bus stand, and then a bus for the main route, and then eventually for the last mile, she would walk from the bus stand to her workplace. So a one-way trip from the north to the southern part of the city takes an approximate 3 hours, which means in total, the woman ends up spending around 6 hours on the road every day for a commute that's not more than 27 kilometers at best. And that's pretty normal. Like I remember this World Bank study done a few years ago where they said that the average traffic speed in Dhaka is about 5.6 kilometers per hour. So this isn't too bad for the distance she's traveling. But again, that's not where I want to focus on. My intention with this visual is to sort of draw your attention towards the effects that she experiences on a daily basis, right? So if you think about a bus stop, where somebody's waiting in line, you're looking around, you're looking at your watches, eyebrows raised. There's a mental vigilance of sort of being alert. There's irritation because people are cutting in line to get into these buses, which are already full. And if you look at the kind of stuff that she says, she got hurt while boarding the bus because there was a lot of pushing and shoving. Let me just use the laser. And then she's angry at herself because, if in case she misses the bus, if she does get the next bus, would there be space for her? She's frustrated sitting on the bus for 2 hours. There's the heat, the traffic, the horns, it gives her a migraine. Or if she's been unlucky and she couldn't find a place to sit, she's standing for 2.5 hours and there's sweat and she's breathing in other sweat. But then she also rationalizes saying that's normal, and that if you live and traverse in one of the biggest metropolises of the world, there's sort of a tacit acceptance that this is how it is, and you've sort of accepted it. So if you go through these quotes, you understand that she experiences a range of emotions. There's panic, anxiety, stress, fear, anger, frustrations. And it's not even just the human elements. There's also these non-human elements of weather, heat, and noise levels, queues, traffic, crowd, just the usual hustle bustle of the city. And so together, these human and non-human elements combine to create this assemblage of unsafety of public transport for her. Right, so if I can divide my findings into these three themes, One, there are these everyday effects that women experience, right? And fear is definitely one of the more inherent ones. And when I say fear, I refer to both the physical reaction of sort of experiencing this paralyzing effect, when you have your body gripped by fear, that your body is almost held ransom to this effect. But then there's also the social component of fear, so fear in its cultural context, fear of drawing attention to oneself, fear of being judged for what you're wearing, fear of being judged for who you're with, fear of being called a liar in case you call out on harassment, but you're unable to prove it, fear of not having support from people around you, fear of encountering the harasser again under worse circumstances, because if this is an everyday commute, you're probably using the same bus route every day. So there's fear embedded in shame, guilt, and self-blame, right? So there's all these levels of trauma, distress, and confusion that one has to navigate on a daily basis, and that serves as a permanent constraint on their mobility and access to resources. So, and this is where it gets interesting. When I asked, does it bother you or does it not bother you? Most of the women said that they focused on reaching the destination safe. And so whatever happened in between was not significant and it didn't merit attention, right? So they'd normalize these aggressions in public transport, which I was referring to earlier, that there was this tacit acceptance. But another interpretation was also this, and this is something that Gardner had said early on, that women also did not want to disrupt their trajectory. So there was a rhythm to that trajectory, and they felt that they were managing power by not reacting to the harassment. So they refused to sort of slow down and acknowledge it. And also there's this, there's that thing that we equate being emotional is considered synonymous with being soft and weak, and it's associated with women. So the subordination of emotions also works to subordinate the feminine body, if I may. So, but either way, both of those interpretations sort of reinforces this unbelonging to the public sphere that women experience. Interestingly enough, when I asked participant next that if you were to, these what if scenarios, like if you were to encounter the same situation again, what would you do differently? And they came up with all sorts of ideas. Some of them said that they would scream out loud. Some of them said she would snatch the harasser's phone and call his family. All sorts of ideas where they were not the victim. So, and what that tells me is that they had probably played this incident over and over in her head, thinking what she could have done different. And what my question sort of offered them was this new vantage point, which would sort of offer them this opportunity to redefine themselves in that narrative in which they were not a victim. And so that's sort of when it came to me that these effects did not disappear after the journey was over, and that this was a long-term thing. So women embodied these effects long after, the harassment was over. This also brings me to my final point, where I kind of wanted to see, so while these effective atmospheres are invisible, they're not inert. They're forceful in kind of enabling or restricting how we act or react to situations. And so what actions, had that power to deterritorialize these effects? So what enables certain women to reach out for help and not so much others? Or what did that action in itself have an effect on others? And I kind of borrow from Sarah Ahmed's work on the effective politics of fear, where she shows that fear works through bodies of those who are transformed into its subjects as well as its objects. And that means that courage can also work through in the same manner, right? And that's something we've also seen with the Me Too movement, that revolution where it always takes one person to break the silence so others can sort of chime in. But what I'm saying here with effects and assemblage is that even if nobody supported, even if nobody chimes in when you call out a harasser inside the bus, it still registers an effect. So maybe nothing visibly changes in the short run, but perhaps nobody believes her, or maybe, at best the harasser is asked to get off the bus, or maybe the harasser stays on and she gets off the bus as a sign of protest. But whatever it may seem like, that things have gone back to normal, but it hasn't. An effect has been registered, and that is a new normal in itself, because there's new power relations that have been established, however so slightly, inside the bus. There's new knowledge and a new preconceived notion to begin with the next journey. So just few final takeaways that I want to leave you at this point is that effect dynamics do not merely evaporate once the journey is over. They inhabit and they embed themselves into these social lives of individuals. Also that women they navigate a mix of effects. So you cannot have fear and courage experience at the same time. They're not mutually exclusive. And all of which accumulate over time. So the decision between reaching out for help or quietly accepting the status quo is more blurred than binary, since they're really contingent on sociospatial temporalities, as one of the speakers before me already pointed out. So all this to say, I use this paper to kind of demonstrate how safety is porous, and it's powerful, and it's not static or inert. And if I can zoom out, my point with this paper is sort of to bring this feminist study of sexual violence and its impact into dialogue with, with public transport geographies in cities. Right, and I'll stop here. Thank you for listening.
Thank you, Ms. Mori. Very interesting work on, the everyday contestations that women face. So thank you. Now, before I invite the next speaker, in case any of you have not yet, I think ma'am announced, so any of you have not yet moved your phone away from you because some disturbances are happening. If you can please keep it on silent mode, it will move it away from you. Thank you so much. And I now request our final speaker from session 1, Ms. Rani Jadhav and Ms. Priyanka Sinha. Ms. from Breakthrough, Ms. Priyanka Sinha could not join us today. So we have Ms. Kritika representing her. Welcome, Ms. Kritika. And they will be presenting work on their work on women's safety in public spaces during their commute to work. So over to you.
I would like to present my presentation with a small video. So, आप भी तो इनवाइट करो ना मेरे को सिखा रहे हो आप ये सब करते हो मैं तुम्हारा वाला आपकी जैसे क्या होता है कितने लड़कियां बदनाम करती हैं कि लड़कों लड़कों को बदनाम आप ढंग से तो कर लो ढंग से टाइम से बाहर जाओ वो कुछ लड़ेगा आपको आजकल तो लड़के कंट्रोल माहौल से मेरी मन ऐसे होता है क्या करेंगे भी कर मैंने खुद ही कहा हमारे पास तो नहीं था
So sexual harassment is happen with anyone and everywhere, and no one is asking for it. So today I'm going to present our work. This is focused on women's safety in the public space. Before this, let me introduce my organization. Breakthrough is an organization that is working for past 20 years to make gender-based discrimination and violence against women and girls unacceptable. As we all know that more than half of the world population living in the cities and with urbanized causing cities to grow more rapidly. The impact of this growth are felt and experienced by everyone, especially women and girls, gender non-conforming persons in a rather disproportionate manner.
as their access, ownership, and right to live in the city is compromised and violated. The experience of women and girls in these cities and their uses of cities and its public spaces are strongly impacted by its gender. With this understanding, we have started the intervention in the Dabwa colony, Faridabad. This is a peri-urban slum, and population is around more than 3 lakhs. So now I'm going to talk about the program design. This is one of the most important slide. So I will spend most of the time in this slide. Breakthrough focus on the social norm change, and we want to make sure that we shift the norm perspective and how it's working in that particular ecosystem to create strategies that we were needed in the program. The baseline finding shows that the existence of gender-based discrimination and sexual harassment in the intervention area. Patriarchal norm strongly influence community belief, attitude, and action. There is a need for the norm-shifting gender transformative approach that would facilitate more equitable social and public space with ample opportunity for women to grow and nurture their aspirations. So one key area that Breakthrough wanted to deepen its work is in the issue of women's safety in public space. So we have done a program in 2 phases. In phase 1, Breakthrough worked with the one of the largest garment factory company, and the project intervention was targeted to create the change within the management system regarding their understanding of sexual harassment at the workplace. And phase 1 intervention result is that there was change in the behavior of the supervisor and the worker. We are more likely to report more severe cases to formal mechanism like police. In phase 1, we have worked with the system and factory, and we have also worked with the committee and public space. But we have seen our changes more in the factory. But and from phase 1 recommendation, we realized that we need to work on the community part also. So in phase 2, we focus on the community part and public space. And here, in Faridabad, the majority of the community member in the community are migrants and serve the source of human resources from the garment factory. So we took the approach of community-led approach and roll out the program for 1 year within the community with deep transformation model. And we work with the different stakeholders such as women, youth, and other community stakeholders at different level, individual level, community level, public space, and system level. And in this activity, based on the phase 1 recommendation and finding, we developed the phase 2 intervention. In phase 2, we had designed different kind of activity. For example, monthly sessions with youth, frontline worker, women group, and strong networking and partnership with the police, Durga Shakti app, district legal service authority. We also work with the auto drivers in that area, and we done community mobilization activity also, like Dakhalo campaign, Nukkad Natak, Youth Chopal, hyperlocal campaign. By doing this, we wanted to make sure that women feel safe at home, workplace, and during commute. We have done different research studies throughout the phase 1 and phase 2, such as baseline, endline, formative research, and safety audit. Today, we'd like to talk about the safety audit, and I would like to invite my colleague Krutika to talk about safety audit.
Thank you, Rani. So safety audit was a methodology which was used by us in the community, and which further brought really good impacts in the community, and some great actions were taken by the youth. So safety audit is an innovative methodology and a participatory tool which is used to collect and assess the information about perception of urban safety in public spaces and commute. It helps to generate data on local gaps around safety of women and girls. It helps to generate evidence which can be used to further advocate with stakeholders for collective ownership. It helps to document local practice and support the new innovation. So during the process of safety audit, what we do is a group from the community, it can be a group of women or youth, come together and they do a safety walk. They select a route and they walk through the route and try to understand the social and physical and social characteristics which makes that particular route unsafe. So the group, so we as Breakthrough, we in the community, we did the capacity building of a youth group. They led the process, they took the ownership, they conducted the whole safety audit process. So the aim of sorry yeah the aim of the audit was to understand the patterns of movement and constraints on mobility of women and girls, to understand communities perception of safety in public places, to determine factors that contribute to the feeling of safety. The safety audit was conducted by the youth. We did their capacity building on different issues like gender, sexual harassment issues, all issues around safety, and of course the whole methodology and the techniques and tools of safety audit. Further, when youth participated in the whole process of safety audit, it was observed that they were able to understand the connection of infrastructure with the women safety, and they were able to advocate for change further. So some of the great impacts which were, I would also like to share about little bit about the process. The process of the safety audit included a detailed route mapping where we tried to find out whether there are proper street lights, what is the gap between the street lights, are they working, are they not working, are there any entrapment areas within the community, are there any signages or cameras or any helpline numbers are displayed within on the walls or in the community so that anyone can access it. Are there public toilets which can be used by women, and what is the infrastructure, are they safe or not? Also, if there is a park, if there is any park during the within the route, what is the measures of safety taken within the park. And major focus was on public transport. Are the autos available, what are the time, how accessible they are to women, and are women able to feel safe within the auto? Because it was seen that there are inappropriate songs which used to get played in the autos. The auto drivers gaze the women from the mirror and all. So we tried to develop tools all around all these issues. The tool finalization was done. Then finally, the safety walk was conducted by the youth, where they interacted with different stakeholders from the community and also observed all these issues. So some great impacts were seen within after this safety audit and after the 1 year intervention which we led in Dabua colony. Firstly, when the findings of the safety audit came, youth organized a big event, Youth Chopal, where they shared the findings with the stakeholder, with the DCP of uh, Faridabad, with in front of the councillors, and they advocate for the issues. Youth, after learning the safety audit techniques, there was a girl who decided to do a detailed survey about the street lights. So she herself identified around 42 spots where there were no lights, or the bulb was fused, or the pole was missing, or there was a big gap between the lights. So she identified 42 routes. She made an application, submitted to the Parshad, the local councillor, and is doing regular follow-ups with the stakeholders. Further, after the 1 year intervention, it was seen that there was an increase of knowledge on sexual harassment, safety, and rights, and also youth was able to use the redressal services which we have in Faridabad, like Durga Shakti application, district legal service authorities, etc. Youth has created awareness in the community about sexual harassment through they designed various hyperlocal and community mobilization events and campaigns where they did wall writings, they did Nukkad Natak rallies, and also they did a campaign with auto drivers where we held this discussion with auto drivers that how their actions can affect the mobility of women, and also effect is also so severe that sometimes girls are afraid to go to college, or they are being dropped out of school, and many more things like that. So we did a discussion with auto drivers. We gave them, as Breakthrough has so many songs and videos, we asked them that you can play these songs if you want them for the entertainment. So that was a small campaign which was done with auto drivers. Further, also after the intervention, boys started realizing that how their actions during the commute are making girls uncomfortable. They stopped harassing the girls and also started advising their friends, their peer groups, that okay, this is wrong, we should not do that, we should not stand at this particular location because it might make other girls uncomfortable. Also, after this whole intervention, a strong partnership was developed with the Haryana police by Breakthrough, because the Haryana police really like this idea of safety audit, and they further want to do this audit in the whole Faridabad, and they want to identify spots which are unsafe. Also, after this, two products came out from the youth. We gave a filmmaking training to our youth. They In the filmmaking training, we taught them how to write a song, how to direct, how to script it. So two songs were made by youth. One was Nazre Nazre. It was showcasing sexual harassment on within the commute, and other was Kaam Karti Aati Nazar Hai, which is a celebration song which celebrates the working spirit of a women. If we would get some more time, maybe, so we would like to showcase these two songs also. Further, uh, way forward, I would like to share what now we are planning is we are trying to ensure police presence in all the unsafe places. We are trying to conduct bystander awareness campaigns. We are doing public policy with different stakeholders, departments, police and DLSA department, local councillor, everyone. We are trying to improve the public transport facility through design and train the staff and increase the monitoring. Also, we are trying to uh, bring out immediate redressal system. We are trying to strengthen the redressal system so that if there are any registered complaints, immediate and prompt actions can be taken through community support. And at last, this is the end slide, and this picture showcases that what change we are trying to bring. So thank you so much.
You still have some time, and if you want to show one of the songs, yeah. Can you play?
So this was shot within the community by the youth. The ideas also came from them only, whatever they face in their daily life. So, and also we have tried to show how three types of actions, how community can support when they see any sort of harassment, how individually we can take a stand for ourselves, and how a group can come together and try to combat the situation.
Thank you for the impactful song and sharing with us and the work from Ground Zero. Thank you, Ms. Rani and Ms. Kritika. Now, before we start the question answer round, I request our first presenter, Ms. Fatima, you may take a few minutes to share your conclusions.
Thank you, Ms. Roy, for giving me a little more time. So, uh, in short, what I wanted to convey through my topic was basically what are the socio-cultural and spatial factors which affect domestic workers' mobility, which include, of course, safety and fear of darkness and fear of crime or harassment is important because when participants used to walk in their neighborhood, when they walk in the neighborhood, if it is dark, they felt uh, the fear of harassment. And next one is the gender dynamics in household. That is because one of the participants pointed out that how the men inside in the household travel for to their work is very different from how women travel. Because she has to wake up at 4:30, finish all her care, cook, clean, and wash the clothes, finish everything so that everyone else inside the home can sit comfortably. And then leave to work at 7:30 or, running after bus or taking negotiating with the last mile connectivity problems. So many things and work till late in the evening and come back. And on the way back, she has to buy groceries or any other healthcare issues. She has to, go. Oh, sorry for this. So yeah, so they have to come back late, and then they prefer to come back early because they have these, norms and social norms that they have to finish. Like they cannot wash in the evening once the sun is set. I mean, after sunset, they cannot, and they cannot go out unless they are escorted by men. and they believe, they stick on to these beliefs very strong. These beliefs are very deeply inbuilt inside their system, so that they conceive it as very positive, and that is what leads their life forward. Also, their religious belief has a greater impact on, and they practice all their religious customs, and all the practices, so that they have a good life. So that is very deeply instinctive. And other things are physical difficulties, especially the target group were majorly between 30 to 50 age group. So they definitely will have something or other as a physical difficulty that will affect their mode choice and travel time and distance to work. And again, making multiple trips is very common among them, especially in case of single earner families. So if the lady is a single earner, she has to fulfill all other responsibilities. If there are older adults in their household, they have to take care of them also. So there are a way forward. In the second phase of my research, I'm actually doing a quantitative survey where I'm trying to map their mobility spatially, incorporating the time geography concept, which is basically an inter-transdisciplinary concept where you talk about the the spatial and temporal dimensions of people's movement. So in this figure, you can see some spatial space-time paths where actually the longitudinal plane actually represents the geography, and in the y-axis you have time. So this defines their accessibility, their accessibility as an individual to the city. So I'm taking that as a measure and trying to, find out the interconnections or correlations between the three factors. So this will happen in the second phase, and finally an integrated analysis will be done. So yeah, to conclude again, though overall mobility or women's mobility challenges have been studied, especially focusing on a particular target group haven't been in place yet. Also, they have domestic workers or other low-income or informal working sector groups have very less awareness about the technical or the facilities that is offered by the government, and they are not using it properly. So that's beyond the scope of this project, but still, again, we have, of course, a lack of gender disaggregated data that need to be in place, and this proposed research will have implication on will inform the existing policy, and also will I hope that I'll be providing a methodological contribution also for developing a framework and to further producing a comprehensive mobility plan. Thank you. Thank you so much for that extra time.
Thank you all the speakers for sharing, so many new things or new methods with us. So now, the speakers who are online, can you please switch on your cameras? And even the audience, I would request everyone online to switch on your camera, because we'll start our question and answer session. So we want to have as meaningful interaction as possible. So now the floor is open for questions and answers for all the four speakers.
Thank you all very much for exciting papers full of insights. And it's also very interesting that all the papers are by women, and there's not a single man who's exploring any of these topics. There's been a whole lot of literature on what was described earlier as the North versus South and East of the country, where gender norms are concerned. A lot of literature has gone into studying different marriage patterns and so on and so forth. The role of women in the household economy, the role of women in agriculture, all these contributed to a certain North Indian versus South Indian and East India patterns of gender norms. I have a question for all of you, because the Bangladesh papers truly shocked me, which is the question that I am asking is that, is there today a North Indianization of all gender norms that are taking place. In other words, is this masculinity, which was characteristic of North India, being imposed on other parts of the country, which were more female gender friendly in the past. And you see this happening in a large number of areas. For instance, today's Karwa Chauth. When I was young in Bangalore, I studied, we never heard of Karwa Chauth. It didn't exist. Now, this is a practice which was restricted to a small community in North India. And it is now spread across caste groups and spread into other regions. And you see these happening in many ways. Dowry in Kerala among the Nair community, for instance. A whole lot of areas you see, is there this North Indianization of gender norms throughout the country, because that has implications also for politics. Having said that, there are two very, very interesting groups of women you might have heard of. One is a Delhi group called Pinjra Tod. They're very famous. Two of them were in jail for UAPA shouting slogans. And the other one is a group in Mumbai called Why Loiter. They brought out a book on the recapturing of public spaces by women. I think those will be useful in your work. Thank you.
Thanks also for everyone, really very interesting presentation and so many linkages across the papers. And I thought that's quite interesting. I have a question to Fatima. In your presentation, you said they didn't want to work as domestic workers in their own city, but wanted to go to another city to work. Is that because of, yeah, what is the, it's one I can understand from a status perspective, but how do you situate it within the whole gender and ethnicity politics in Kerala? And that's
Thank you for the question, Dr. Bailey. So this was interesting for me as well, because as I don't know, we supposedly call us as educated and privileged. So we don't have this dignity of labor, which we do not consider that as such. But then I have seen people. I never expected that to be present in their from the target group, their answer from the target group. But then they conceive this job as when they compare to someone who is more privileged or more economically well than them, they consider their job as of having low dignity. And especially in Kerala, we have people are more they are developed, they are more progressive, especially in cities. You cannot, nobody will be bothered about what you are working at. That's there. But still, this particular target group that I'm talking about, they stick on to something that is deeply there in their thinking of their social norms and the responsibility or social responsibility that the society has given to them. And most of them are less educated, and they surprisingly they consider that as a low profile job in fact. And some of them even chose chose a job as a cleaning staff in some institutions or something, rather than choosing a domestic worker. And many of them because they are much more organized, and this is not an organized sector. And they have a uniform when you go for, even if it is cleaning toilets and in a hospital or in an institution, they have a uniform. They have when they go out, they have a job which they can so they choose that over a much paying domestic job. And some of the participants even told me that I would have never done this job if I had if my husband had a little more income, additional income. I would have never gone for this. But no, there is no other way I have to go. So even I am surprised to see that why they consider that. That's still there.
Because from earlier studies in Kerala, you can see they would go abroad, like go to the Gulf to do domestic work, or
but they don't prescribe going in Kerala.
au pair also, but not within Kerala.
Yeah, so that that is there
Okay.
within the mind. That's what I understand.
In your paper, I thought you stress a lot on these norms and behaviors. I would encourage you to unpack that bit. What exactly is that norm? Because it otherwise becomes a too much of an umbrella term to put everything under.
Yes.
Sometimes it may not be cultural norms. It could also be how these people are kind of appropriating some norms and not appropriating other norms. So try to unpack that and see maybe you can find other directions or other motivations. Not so
Sure,
much.
sure. Yes,
Yeah.
I shall do that. Now I have put it
Take
under a broader
perspective.
umbrella. Yeah, that's right. What I actually intended to thing is the coding is done by myself with my knowledge. So definitely I'm working more on that further also. So I hope it will be more unpacked out, in this way. What I wanted to include, whatever things that I have identified, which I included under this particular theme is that they practice a lot of religious things, be it a Hindu or a Christian. They have, for Christians, they have a prayer at night, family prayer. They do it together. And for Hindus, they light the diya during sunset, before sunset. So all these things are seriously affected. And they used to talk a lot about these kind of things, the belief that is instinctive. They cannot, get out of that thing, and they cannot compromise on these practices and beliefs, which is actually taking them forward in their life. So that was very much deeply there. So now I have to, like you said, I have to decategorize maybe, these things.
Thank you, Dr. Roy. Thank you, Dr. Bailey. Please feel free to ask questions. We still have time for the questions. Please.
Thank you, Chair. I have a comment to Seema's paper. Seema, it was a very interesting paper. I really enjoyed listening to you. I have one suggestion when we look at effect and assemblages here. I mean, I really like the way you connected with effect and assemblage. But here, if you look at assemblage is if you are assemblage is like the emergent property of something. So when we look at the emergent property, you have very clearly distinguished how interaction, social interaction, daily interaction, everyday life, other things are actually forming, I mean, making into contributing to that assemblage. And affect is also part of that assemblage. Like affect is also one of the pillars which is actually constituting the assemblage. So my point too is that we need to also look at other things like institutional mechanisms, designs. So the assemblage is a larger concept. My point is that when you use assemblage, it is much larger than definitely what you have listed out are all part of it, but it is a little larger than what we see right now. So please try to include those other things, institutions, social institutions, physical institutions, designs, other things along with your socio-cultural categories of assemblage. It will be really interesting. Thank you.
Thank you. Thank you, Sobhan.
Thank you, Dr. Sobhan.
First of all, congratulations to everyone. Really excellent presentation. Thoroughly enjoyed it. So I have like one generic sort of reflection, comment, or a question kind of thing. So as Professor Rao said, all the presenters were women, and the gender was also operationalized heterosexually. So everywhere in all the gender aspect, we didn't see anything about transgender or gender non-normative people experiencing spaces or travel. So one of the thought or question I would like to hear more from especially the video part of it. Was there anything that came which was about, let's say, transgender people experiencing spaces? Or because in video, in research, I can understand that there could be certain sort of limitations, but I could really see very well effort to represent, different components, like the class part was there, the age part was there, and everything was there. So was there any conscious thought on bringing transgender or gender non-normative aspect in the video, and how did you deal with that if that was there? And the other sort of question in most of the presentation, for example, in Dhaka's presentation, the researcher reported 45% women wear hijab to appear less attractive. In your video also, it starts with wearing clothes. So we know that, clothes and their association with abuse has been there. So in what way, as a researcher, because that's not really related to mobility or transport. So how these aspects are dealt with in the research context when talking to the participant was something I was wondering.
Regarding the transgender thing, actually, we were quite focused on this part only. We did not work with transgenders, and in the colony itself, there was a quite less representation of this particular community. So this didn't cross our minds. And the next, can you please repeat the next question?
Yeah, it was more of, so I'm also not very clear in my mind, therefore the question is also not very specific. But it's a general thing about, so we see that linkages about wearing particular kind of clothes and linking them with sexual abuses in public spaces. So whenever working with the communities, either in the form of data collection or, so when people, let's say in Bangladesh study, when they report that, we wear hijab to appear less attractive. So is there any effort made to sort of address this norm? And if it is made, then in what way is probably.
Okay, so as you are talking about clothes and everything, so it is a cultural norm. It is in Dabua colony also there are youth girls who want to wear certain kinds of clothes, who want to go out, go college, go study, and even walk freely through their lanes, but they aren't able to do it because all the street harassment that is going on in the community. So it also came out as a big challenge for us. And
these are the cultural norms, and the public safety issue is a more a broad issue, but we need to work on the culture, the existing norms, to change the mindset of people. So we work with the nuances. Can I speak in Hindi? तो जो एक बड़ा इशू है, बट सोसाइटी में नॉर्म्स बहुत सारे एग्जिस्ट कर रहे हैं, तो उससे रिलेटेड हमें इश्यूज पे काम करने की जरूरत है। तो हमने जैसे बेसलाइन किया और जो सेफ्टी ऑडिट, उससे निकल के आया कि अगर लड़कियां कपड़े छोटे पहनती है तो वो सेक्सुअल हरासमेंट के लिए प्रोवोक करती है, या किसी वर्किंग वुमेन बाहर जाती है तो उसको छेड़छाड़ होता है। तो ये छोटी छोटी जो नॉर्म्स है, कहीं ना कहीं वुमेन को फेयर करती है पब्लिक स्पेस में जाने के लिए। तो ये नॉर्म्स पे हम काम करते हैं, और जो हमने अभी बताया कि हम उनके साथ मीटिंग्स करते हैं, जेंडर इश्यूज पे ट्रेनिंग करते हैं, तो इस तरीके से हम उनका माइंड शिफ्ट करने की कोशिश करते हैं इन इश्यूज के अराउंड। और इसमें जो पहला क्वेश्चन था कि सिर्फ वुमेन का ही क्यों, तो हमारे काम में जो हम रेस्क्यू में काम करें तो रियलाइज किया कि क्योंकि ये सिर्फ वुमेन का इशू, वुमेन ही काम करेगी तो काम नहीं बन सकता, तो हम इसमें मैन को भी इन्वॉल्व करते हैं। और जो ये फेज 2 है, इसमें यूथ को हमने मेजर स्टेक होल्डर समझा है, क्योंकि अगर हमें किसी भी सोसाइटी में चेंज लेके आना है तो यूथ एक ऐसा मतलब एक एजेंट है, चेंज मेकर एजेंट है, जो कि वहाँ पे कम्युनिटी में खुद ही अपना आवाज उठाएगा और प्रोग्राम को सस्टेन लेके आएगा। तो उनके साथ हमने काम किया, और सेफ्टी ऑडिट में जैसे कृतिका ने बताया कि उन्होंने खुद से लीड किया, हमने टेक्निकल सपोर्ट किया। तो वहाँ पे धीरे धीरे ऑनरशिप आ चुका है, उन्हें रियलाइज हुआ कि सेफ्टी एक इशू है, सेक्सुअल हरासमेंट इशू है, हमें उस पर काम करने की जरूरत है। अगर कोई दूसरा सेक्सुअल हरासमेंट करे तो उसे रोक भी रहे हैं, पुलिस ने भी हमें सपोर्ट करने की कोशिश की। तो इस तरीके से धीरे धीरे मैन के साथ भी काम करें, यूथ के साथ भी काम करें, सिर्फ वुमेन के साथ काम करें तो बहुत है। एंड सिमिलरली फेज 1 में जो हमने फैक्ट्री में काम किया था, वहाँ पे जो सुपरवाइजर जो हायर पोजीशन है वो मेल पोजीशन में ही है, मेल है पर्सन। जो लोअर पोजीशन में जो वर्किंग वुमेन मतलब जो काम जो नीचे पोजीशन में करते हैं वो वुमेन है मैक्सिमम। तो वहाँ पर सुपरवाइजर जो थे, एचआर थे, उनके साथ भी हमने ट्रेनिंग करने की कोशिश की, क्योंकि जो भी कंप्लेन आता है हम ऊपर जाके बोलेंगे, अगर वो जेंडर इश्यूज पे मतलब अवेयर नहीं है तो वो इश्यूज को सही तरीके से डील नहीं कर पाएंगे। तो इसलिए हमने सारे लेवल पे काम करने की कोशिश की और मैन एंड वुमेन दोनों के साथ।
और वो आपका एफर्ट काफी अच्छी तरह से रिफ्लेक्ट भी हो रहा था। मेरा सवाल इतना ही था कि मेन और वुमेन के अलावा भी जो जेंडर के
उसमें
हम
भी
पहलू
हमारा
देखते हैं
अभी
तो
कोई
उसमें
काम नहीं है।
हाँ, बिल्कुल।
डिड द यूथ या वो यूथ क्योंकि उन्होंने डिजाइन किया है वो सॉन्ग, उनके इसमें उनको नहीं लगा कि कुछ अदर देन द हेटेरोसेक्सुअल एलिमेंट के बाकी जेंडर आइडेंटिफाइड पीपल को इंक्लूड करने के लिए, डिड दे आस्क फॉर एनीथिंग, दे वुड हैव थॉट ऑफ दैट? क्योंकि ये डायरेक्शन जो लिया है ये वो लोगों ने खुद लिया है या वो ऐसे ऑर्गेनाइजेशन थ्रू ये प्रोसेस है?
जो एम है हमारा इश्यूज के अराउंड वो हमारा है, बट जो इश्यूज वहां से निकल के आई वो समुदाय का है। जब हमने इनिशियली स्टार्ट किया था प्रोजेक्ट तो नीड असेसमेंट किया था कि सेक्सुअल हरासमेंट में भी हमें क्या करने की जरूरत है, तो वो जो इश्यूज है वो कम्युनिटी से ही निकल के आया, तो उसकी बेसिस में हमने प्रोग्राम डिजाइन किया और फेज 2 फेज 1 की बेसिस पे आया, तो कम्युनिटी का ही इशू हमने फोकस किया है।
सेक्सुअल हरासमेंट में सिर्फ वुमेन को फोकस किया, मेन के ऊपर सेक्सुअल हरासमेंट पे नहीं किया?
नहीं, वुमेन के मैन के साथ भी है बट वो केसेस कम है क्योंकि वो बोलते वो उतना अभी वो स्पेस मिला नहीं, क्योंकि अभी वुमेन सेंट्रिक चीज है कि वुमेन के साथ ही होता इस तरीके से, पर मैन के साथ भी है कुछ केसेस जैसे बॉयज के साथ है, तो वो चीजें निकल के आई है पर नंबर कम है।
Yeah, if I may, I think I have also seen a lot of research being happening around the gender based access to urban transport. But in my experience of working with a few ministries, it generally does not transform into any policy document or a mandated document as such. We still talk about, for cities, we develop comprehensive mobility plans, which look at passenger mobility. And I would say a part of it, like out of a 100-page document, 1 page is dedicated to freight. So I think the bias starts over there, and it still does not have that component of gender inclusivity, etc., being addressed as part of public transport reforms and strategies as such. So I would also like to understand, like there are a few, I believe, incentive schemes, etc., which are provided. What comes to first to my mind would be Delhi's scheme for making public transport or bus free for women. So are there any other examples, maybe in India, in any other state or outside? If there is something which, because you have researched all the members or the panel speakers today, would you like to shed some light upon if there are any such examples further, or how this could be, further incorporated in certain documents where it does not stay as a research, it also comes into implementation and brings the right kind of multi-stakeholder engagement? Anyone? Yeah.
Thank you for the question. Any of the speakers would like to address that?
Maybe Mauri, you could come back to that based on your review. I think that's maybe a good link to what Pramod's asking.
Yeah, thank you. I also had a few things to share earlier, but I couldn't unmute myself. So maybe we'll start with this and then I can sort of end with my responses to a few other questions. Thank you, Pramod, for the question. I conducted a systematic review a year ago, but I did look at the range of safety interventions that's been implemented across South Asia, which includes, reserved seats for women or women-only buses. Also, a subsidized fare scheme for women commuters. But I think what it all kinds of boils down to is the fact that when you make special allowances for a certain community, there tends to be this backlash from other communities, and hence the intervention itself is usually not sustainable. A, and B, there's also the backlash kind of also makes those spaces or public settings quite hostile to women commuters. So if you take the reserved seats example, for instance, having 6 to 9 seats in Dhaka buses for women usually makes, either when you get on the bus, you see men sitting on them, and then when you ask them to move, they go like, oh, if you're so much about gender equality, why do you get, special treatment? Then there's that whole argument about if these 6 to 9 seats are for women, the rest of them implies that they're for male. So, and that's also the kind of internalization that women themselves go through. And hence, I think a lot of these interventions are not necessarily well thought out in terms of to what extent does it push the envelope of establishing rights for women to public spaces instead of making special allowances for them to be safe in that part of the journey. And which reminds me to, sort of remind this thing that safety for women is sort of a door-to-door concept. That's what we're trying to put forth, that it's not just limited to the public bus in itself, but the moment she gets out from home and until she reaches destination, you sort of have to take safety into account for the whole journey. I don't know if that sort of addresses what you were referring to. I don't necessarily have the exact, I think another colleague of mine was working with the FFPT scheme in Delhi. So Sakshi, I don't know if you're there, you might be able to answer more clearly.
Any other speakers would like to, add on to what Ms. Maury said?
So, in line with what Ms. Maury has mentioned, in Kochi city, we have measures like just like in several other cities, we have women-only cities, employing women and even transgenders in public transport. Kochi Metro is the first public facility which employed transgender community as their employees. And that was a very great news also all over India, but then later it did not sustain because of several reasons. So they didn't, in Kochi, when compared to many parts of India, we have more recognition for transgender community. So this is an answer for your question also, sir. We have more recognition for them. They are more, they get more opportunities. All those things are there. There are several measures also from the government part, from the GCDA, Greater Kochi Development Authority, and from the corporation also. They have, for their empowerment and their skill development, there are a lot of things are happening. But then these kind of measures does not sustain. Many of these things does not sustain because of the similar reasons what Ms. Maury has pointed out. And they still, even the transgender employees who were appointed in Kochi Metro, now they face difficulties in maintaining their job because of their they were less competitive when compared to other employees in the facility. So there are a lot of things that should happen at the ground level, just like what Breakthrough has done. The lot of interventions are needed at ground level to change the situation. Unless and otherwise, we cannot implement all those things that is there in the paper. First of all, things to get into paper itself is difficult. We have to, from all our research, we have to prove that problems exist. And then we have to face these backlashes. And then something once comes into paper, even the transport policies in a local government administration or in local body, you might not see a page for, you might see only one particular paragraph, only just, with a few sentences saying gender inclusive measures that should be adopted, even in the recommendations or suggestions. But these, as a community, all of us as researchers, we have to give these recommendations and guidelines, implementable, practical solutions. That's what is actually needed, which roots back to, which is very context specific things, the problems are this is a very subjective issue that we are talking about. So it differs according to the geographical context, the cultural context. So at the local body level itself, we need to have implementable solutions incorporated in their plan, in their ODP, like development plans, local body development plans. That has to be very context specific and practical solution. That is what I have felt from my research. Again, sir, I had actually initially wanted to focus or take the target group as transgender community because I have more, I felt that I might get a lot of participants in terms of, being a progressive city, as we call ourselves progressive city. But then due to the limitations that, my institute or my, I have to, as a researcher, I have some limitations. So I had to, restrict my scope of study to women. And even if you look at the literature, you start typing the keyword gender issues, you will see only women issues. So transgender issues are there, but it's very less in number. And that's a very, a very important area that should be further investigated or intervened, dealt with. Yeah, so I'm expecting the future scholars and researchers to put more, interventions in that. Thank you.
Thank you, Dr. Suresh. Thank you, Dr. Pramod. No, that is what she wrote.
And now she can.
Hello.
Hello. Yes, please share, Sachi.
Yeah. Okay. Hi, everyone. So just adding to what Mauri was talking about, in my interviews in Delhi around free public transport, like Mauri mentioned, the thing was, even with good intentions, the way that the scheme was probably popularized or advertised, it became as if women were being given freebies. There was no like sort of situating the problem in terms of unequal transport access, gendered inequalities. And so as a result, based on the in-depth interviews, buses became hostile sites for a lot of the research participants, because the conversation got turned into, you are getting free seats and now, you want to travel for free without paying any money to be here. Another thing, so that was one aspect of it. Definitely there were like mixed responses in the sense that there were research participants who told me that on their daily commutes, the visibility of women had increased for them. They were seeing more women stepping into the buses, even like going to a faraway wholesale vegetable market, because it would be more convenient for them to buy vegetables from there rather than like nearer to their locality. And so they could go in a group. So those conversations were also happening. The hostility was happening. The other part was the kind of commutes that the participants themselves were taking. Amongst all of these interviews, there were actually, most of the women were traveling to distances less than 5 kilometers, or between 1 or 2 kilometers, for which mostly buses were not being used. Either the participants were walking or shared transport like shared autos or Grameen Sevaks, they were being used. So anyways, like they were paying fares for these rides. It was more in longer commutes that a lot of the research participants were actually using buses, but their numbers were less, if numbers matter at all in that sense. But in most of the, like if I talk about the transport modes used, it was a combination. So along with buses, there were a lot of other modes being used as well. And very few research participants were actually making use of the buses. Yeah.
Thank you, Sakshi. We can take one more quick question.
Okay, can I add something?
Yes, please.
Okay, so actually with I'm adding up with what Maurice said. She has mentioned that actually about the gender policy, gender issues. Actually, issue has to be there in the national transport plan. It has been addressed like that. The gender, it has to be gender inclusive. So nothing elaborately, it has been said that how it can be elaborated, first of all. And also from our study, from my study or her study or any participant study, it can be seen that gender issue actually starts from every aspect, not only for bus or like you can't suppose like providing the separate seats or providing police at the bus stop. It will not solve the issue. So first of all, I think perception, people's attitude has to be changed. One thing, the people has to their attitude towards female, because while I was interviewing in the focus group discussion, there are really high educated people, women, and they're from the second focus group discussion participant, and they were one lady was saying that she was traveling by shared motorbike, because we have Uber, in the Uber we have a shared motorbike itself. And while traveling to workplace, actually her boss actually commented very badly that because she was sharing motorbike with a male driver, rider. So it has to become from within. And also another thing I want to mention, the gender issue in one, actually in Dhaka, bus rapid transit is implementing. So in the bus rapid transit, gender issue has been included in the policy document. It has been included. So but it's mostly for the low income women, those who are bus in the bus rapid transit area. Actually there are a lot of garments factory. So those issue mainly addressing the low income people, and they are giving subsidy and all this thing, but that project has not come up yet. So yeah, that's all I want to add with Mori. Yep. Thank you.
Thank you, Dr. Shamin. Yes, Shivani.
I would like to ask Ms. Sharmin to elaborate on her finding, even though harassment is an issue as emerged from focus group discussions, but mathematical models did not resemble that. So I would like to ask what kind of methodologies or processes that they used for both the focus group discussion and for the MNL. If she could briefly elaborate on the questions that were put together for both these processes.
So can I just for understanding, can I repeat your question? You were asking why in the mathematical model harassment is not coming up as a significant factor. Is that so?
Yeah.
Okay. Yeah, actually, while traveling from the discussion, they have reported that harassment is an issue. Harassment they are facing while everyday travel, while walking, they are facing teasing, or some people might commenting them badly, or while traveling by bus, people are trying to touch, or they are giving bad comment, even while driving. Actually, for those female driver, they are facing some verbal comment. So but in the model it is not coming up, because model is actually replicating the actual scenario. Actual scenario means even though they are facing harassment, it's not that for that harassment they can change their travel pattern. They are facing it, maybe it is a very significant issue, but because of harassment they can't choose not to choose walk, and they can choose to go by public transport or by rickshaw. So anyhow they have to walk. So model is giving that not as a significant factor, harassment. So other than other factors such as social demographic factors such as age, income, even marital status, dependent number. Even dependent number has a issue while choosing their mode, while nation. but the safety or the like safety means the perception of safety or the concern for the safety is not coming as significant because of that that is that is the one reason that actually they can't take account for that those issue for their like travel behavior, because there are not of because one problem is their affordability, and another problem is unavailability. So there are not many options. Suppose for the low income people, they don't have much option other than walking, or some those who can afford, they can take Laguna as like paratransit or bus for going to long distance. That is the reason actually in the mathematical model, harassment is not coming as a significant factor. So that's why actually for the model justification or model argument is very necessary to have some complementary qualitative argument. Otherwise, model will not give us the exact result. Yeah, that's my answer. I hope that answered your question.
Yes, thank you. Thank you, Dr. Sherman. Thank you, Shivani. Ms. Maury, do you have a question?
I did. I wanted to ask Ms. Fatima about one of her findings, because she, about informal domestic workers. Because I did a few interviews with some of these members, and what I found was this reflection of this group of women not being homogeneous, and that there are varying thought processes behind it. So a lot of these, informal domestic workers, they were patriarchal in their responses themselves. So they were the ones policing younger women in terms of what they should be wearing when they go out in public transport, or who should they be with, and all of that. And I was wondering if that's something that came up in her study.
Thank you, Ms. Maui, for reminding me about this fact. This actually, yes, definitely, this income group of this class of people, they definitely consider themselves, consider patriarchy as a necessary setting of society, and they live in patriarchy, in a patriarchal setting, and they believe that that's okay. So that's why they choose to, fulfill all their duties. They consider their duty as a woman in a household, all their care responsibilities. They consider that they give them a lot of importance, so that that cannot be compromised to, to balance their difficulty while traveling. Their mobility issues are not, worth discussing for them when they they rather discuss more about the issues that they are facing in the household, but they are not blaming any men in the household. They just, okay, this is our fate, we have to go through this. We are okay with that. And that's what the response that I got mostly. So maybe just like you said, it is that class of people which has a similar background of education and similar background of economic status. They consider this as they have that they're inbuilt in their system, in their living. So maybe if my target group has changed to a much higher group of income group, it would have changed. Their perspective towards their issues would have changed. So I was actually very surprised to see all these findings, and I didn't know what to do with these findings finally, because I was expecting results just like what the literature says, the problems that what literature say, but the results were different, of course. Now I'm expecting I'm actually expecting much better results from my quantitative part, where just like Ms. Sherman said, you might get a different result when you approach it quantitatively, but then we have to incorporate all these findings together, and we have to read it together so that you get a useful recommendations. You can develop useful recommendations. So yeah, that was there in my findings as well.
Okay. This is a follow-up. We should really avoid from homogenizing our participants. by saying they all belong to a particular economic category, they all are lower educated, so they all should have this kind of an attitude towards their lives, is you're taking away the agency of these women. You're taking away their rights to look. By homogenizing them and telling they're all the same, we are robbing them of their agency. We are robbing them of their individuality. The whole idea of doing qualitative research is to unearth that individuality, to get that range, to go deeper, to understand why does this affect this woman differently from the other person. So I really request you not to homogenize your participants. Try to really look for that diversity.
Sure, sir, sure.
Just a very quick addition on a similar line. I don't think it's really a class phenomena that only women in particular class have, higher patriarchal views of value, because that's, 40% of the people, women who answered in NFHS, they justify beating by husband. Or we did one evaluation study of all women, police stations, whether they were helpful in preventing gender-based violence, and they didn't, because most of the women ended up convincing the women victim that how it is for women, we have to compromise and we have to live with it. So it's not a particular class phenomena. It's something as a society we all grow up in, and therefore unless and until there is conscious effort, it's difficult to remove those patriarchal norms.
Thank you, everyone. I know it is becoming more and more engaging and interesting, so that's wonderful. But then we have come to towards the end of the session. So I'd like to thank all the participants in the audience and everybody for making this so interesting and bringing forth so many dimensions, like the complexities you talked about, and then the intersectionality, and then the social norms, how women are invisible, and then also time poverty, I think you touched upon. And then the continuous process of, constructing and deconstructing safety. So this is really nice. I mean, thank you for the presentations, for the questions, the answers, and the suggestions. And, so this brings us to the end of a very nice, session 1 on gendered access to urban transport. And, other questions, I think this session is followed by lunch now. So we can take the questions forward and have informal discussions and meet and talk to each other over lunch.
Big
So
round
thank you,
of
everyone.
applause to all the Dr. Charmaine, Mauri, and Sakshi. It's a pity you're not here, but it was great to have you all online participating.
Why aren't they? Thank you.
Yes, you should ask them.
Thank you.
Thank you.
Sakshi already told us, Sakshi does. Mauri already told me she had a major FOMO at this moment.
You can have my share of lunch today.
Yeah.
2 of us.
Thank you.
Okay, bye. Bye, everyone.
Apparently, you don't have FOMO. Yeah, lunch ho gaya. Major league you could have.
No. Yeah. Yeah, no, I mean, actually it's all experience because you've done with the participants. So now that you're yeah. You don't yeah. We're all Ladies, you're not coming for lunch? Rani and Priyanka.
Outside.
You can sit. So, good afternoon, everyone. Welcome back to the session, the second session. We have Professor Mohan Rao to chair this session. Professor Mohan Rao was teaching in JNU at the Center of Social Medicine and Community Health, and he has been working on various issues of population policies, and he has written several books on that. One book by Sage is still a highly quoted book. I don't want to see he stops me from saying all other things. I request you to start the session.
Thank you. Welcome back after a wonderful meal. And I know we're all feeling a bit sleepy, and I hope the papers wake us up. I'd like to begin by thanking Sobin for giving me the opportunity to come here and listen to all the wonderful papers that I have already heard. Now, before I allow the paper presenters to start making their presentations, I'll just take 2 minutes of your time. Once, and this struck me, I hadn't thought of it before, a disability rights activist reminded me that we are all temporarily able. I think that's a very, very deep insight. And it is also substantiated by epidemiological data. Most people with disabilities are not born with disabilities. Most people with disabilities acquire disabilities during the course of their lives. In India, of course, the biggest cause of disability is accidents on the roads. India has the highest rates of road accidents in the world, and therefore we are contributing in various ways by bad urban design to increasing disability. So I'd like to state this before we go on. I'd like to invite Salim Jahangir, Ajay Bailey, Mohammed Shanawaz Hussain to make their presentation. The modes are expensive for me, but I am helpless. High costs of urban mobility and inequalities of accessing public transport amongst working-aged wheelchair users in Dhaka, Bangladesh. Thank you, Salim. And welcome to Bangalore. If this is your first trip, I hope you're staying on for some more time, because Karnataka is the most remarkable state in the country. I'm being very jingoistic. You have the oldest rocks in the world, oldest rock formations in the world, just a little bit outside where Sholay was shot, you know, so you can do a rock trek. You want to go to a tropical forest, you will have that. It offers just about everything, the splendor of Karnataka's temples and its history. So stay on for a week and see it.
Thank you, sir. Thank you.
The horrible part of Karnataka.
Yeah, thank you for this opportunity to present my research work, and thank you, Professor Mohan Rao, for inviting me to for this pleasant stay at ISEC. This is my third trip to ISEC, and last two were regarding one was about this project's kickoff meeting in 2019, and before that I also attended one of the conferences, Global Aging in 2016 December. Yeah, so So, my name is Salim Jahangir, and I am a postdoctoral researcher in EQUIMA project. My study area is in Dhaka, where I'm looking at the urban mobility issues of people with disabilities as well as older adults. So today's presentation on high cost of urban mobility and inequalities of accessing public transport among wheelchair users is the part of the second set of data collection that I collected during April-May 2022. Before that, I collected data on older adults in 2020, January, February. So I would like to just give a background of the study. Like there is a well-documented study on the people with disabilities, which they are vulnerable, not in terms of their social and economic condition, but they always pay higher cost for their mobility and whether it is in terms of accessing their working place, or whether in terms of their accessing healthcare facilities, or for social interactions, or to whether they want to meet the relatives or family members. Yeah, and this has increased the risk of poverty as well as social exclusion simultaneously. So in this study, we refer affordability not in terms of the cost of travel, but the ability to undertake different transport movements, whether it is the intra-neighborhood mobility or inter-neighborhood mobility. For this study, we have taken Amartya Sen's concept of capability approach, where he very deliberately explained how disability is associated with poverty, and how poverty leads to the marginalizations of vulnerable communities. So in this theory, the income using part or handicaps that Amartya Sen has defined it as conversion handicaps, which cause for additional expenses for accessing different goods and services, and to get different functions in everyday life. In this study, we tried with this study, we try to associate with this how negative social attitudes and behavior in general also contribute to force the people with disabilities, particularly the wheelchair users, to make more fair for their everyday mobilities. In addition to that, to look into the intersectional perspective of it, we also use Crenshaw's theory of intersectionality, where here we use the ableism, gender, and low income as their different dimensions of this intersectionality. With this study, we aim to address the research questions of like, what are the challenges people with disabilities face to access different modes of transport for their everyday mobility, in particularly in Dhaka city. So, we aim to bring out the socio-cultural context of affordability challenges they face in that particular urban mobility situation in Dhaka. So for this study, we employed visual surveys, including photography and videography, where we noted the different built environment characteristic of different nodal centers or the main junctions for accessing public transport, which is the nearest to the neighborhoods. And after that, we conducted 30 in-depth interviews with the wheelchair users who are employed with a paid employment category, so that we can capture their everyday mobility activities. In addition to that, we also interviewed 10 rickshaw pullers as well as auto rickshaw drivers to see how they play role in getting in and getting off the people with disabilities in this particular study. Like, what is their contribution in the mobility of the people with disabilities? Yeah. So the main thing that we found that came across first is they have to pay extra direct cost for their mobility to access different modes of public transport. So bus is the most common public transport in Dhaka, where more than 37% of people use that. But it's depend on the age and ableism, or so-called able people who are young, educated, and they can quickly get into the bus. They are able to access those buses. But for people with disabilities, particularly with wheelchairs, it's very difficult for them to get into buses. So it's not their personal impairment that create barrier to access bus, but it indirectly the behavior of the conductors and the bus drivers, who also deny to get them in, because they take little bit more time than non-disabled person. So it forced them to take other modes of public transport, including CNG, that is auto rickshaw, so which is much more expensive than buses. For a certain distance, for a particular neighborhood to another neighborhood, if it takes 10 to 20 rupees or taka in Bangladesh currency, for a non-disabled person, in bus, it would cost for around more than 20 or 15 times, like more than 250 rupees to 30 rupees. And again, if a disabled person is accessing CNG or auto, for the same distance, they have to pay higher than a non-disabled person in the same mode of transport. The other mode of transport that they access is rickshaw, which again, it's much costlier than the bus, and app-based transport like Uber. So one of the participants say, when they see us with wheelchair, itself creates an impression that this person is helpless. They don't have, this person has no other option, like he will come get into my vehicle. So it depends on the bargaining of the fare. So automatically they charge extra. It's on this they can say it's not only one person, but they say we also have to take your wheelchair, so they also charge for that. In addition to that, there are other direct costs associated with their mobility, like they need certain assistance, or since the Dhaka city is too congested and the road condition is not that conducive that they can move independently, so they need a company. So every time they don't get family members as their companion for mobility, but for that they have to take a person, and they have to hire a person for that, and they have to pay for that. So when they plan to move out, the first thing that came into their mind is whom they can hire for going out. So even before accessing public transport, they think that I need a support from another person. So how much I need to pay that person, and that is on daily basis, and that's not a regular one. So I mean it, and also it prolongs their journey. And other thing is about their assistive devices, like as I was mentioning that the road condition is not that wheelchair friendly, that sometimes their wheelchair also get damaged, so they have to repair it on regular basis, or sometimes they have to buy, like if after 3-4 years they have to buy a new one. And even the technology assisted wheelchairs are not usable in that particular context, like since the footpaths are not well suitable for the wheelchair users, their wheelchairs get damaged. So they generally use a folded manual wheelchair, which is a less costlier than technology assistant or wheelchair. So I would like to play a video here. So I would just to show how, like why they need an assistance, because of the safety and the risk of moving around on the streets in Dhaka, where they have to take main roads rather than taking footpaths because of its dismal condition or poor conditions. So it's not easy to cross a road, or going for working place, or for social interactions. So they need assistance. So for that, it costs like much higher than a non-disabled person. Yeah. So the other dimension of it, that what we found, that the negative social attitudes towards the people with disabilities also lead to make more costlier or accessing public transport, because there is a certain perceptions among the common people in society that most of the wheelchair users are engaged in begging activities. So what most of the participants, they express that when we go out in public space, people think us that we are beggars, we are here for begging. So generally they avoid us, or when we stop any vehicle, whether it is a rickshaw or auto rickshaw, the first impression is that we may not pay the rent or the fare. So or if they see that my wheelchair is technology assisted, or it's a folded one, or it's a sophisticated one, they charge higher, because they know this person is economically well off. That's why the person is using that wheelchair. And if I'm using a normal manual wheelchair, they do not want to take us, they deny. And so this also creates the barrier to move out because it prolongs their journey. They have to wait long to get a vehicle. In addition to that, we also found that they have very limited opportunities for them. And here, Amartya Sen's concept of capability, as Professor Mohan Rao is saying, that it's not their personal impairment which is creating barrier for getting opportunities, but it's the interactions with the environment or the socio-political conditions of particular context that they are not able to getting it. So it's the socio-political conditions which creating barriers for their opportunities to get more opportunities for older adults. And
5 minutes more.
Okay, I'll try to complete. In addition to that, we found another intersectionality, that is gender norms, because besides their personal impairment, it's the gender norms which heighten the risk of being social exclusion, because women are getting less opportunity to get absorbed in formal work sector, or others. And in addition to that, they are more vulnerable, particularly for moving out in public space, being aged, because I have taken those people with disabilities or wheelchair users who go out for working. So the working women face a higher level of vulnerability when they go out. It's the perception of the risk of being fall or being stolen, or they're stolen of their belongings. Sometimes they also they force them to take app-based vehicles which they perceive is more safer than public transport, the other modes of public transport. Apart from that, what we have found that the other transport injustices, including the acceptability, the design of the public transport is not acceptable for them in terms of, in the sense that their wheelchair is not accommodable in the existing public transports over. And the other thing is that what Dr. Sharmin was talking about, the using of Laguna from the low income group. So for other public transport like bus and Laguna is always like overcrowded. So they deliberately avoid it, and it's not acceptable for them because they feel unsafe for that. And these two public modes of transport are really so fast that they always want to people to get in and just start move forward. And though the frequency is quite high, like the availability is there for non-disabled person, but for disabled people it is not available, because they have to wait long to negotiate for fare, as well as and they have to see if the driver is accepting their fare, or they are ready to go to their final destinations. So that also create barriers to access the different modes of transport. In addition to that, as I was mentioning about paths, the infrastructures like footpath, zebra crossing. Here on the pictures, what we found that there is a zebra crossing, but there is still bars in between to stop the motor bikers so that they cannot take U-turn. But I think the engineers or transport engineers might have missed the idea that what about the wheelchair users, where they can take to get U-turn. And yeah, another issue is that the geographical proximity of those main nodes or the main junctions. So the lack of first and last mile connectivity also creates this force the people with disabilities to take the other modes of transport, which are more costlier and which can take from their doorstep. Yeah, and what are the impacts as we are saying that it's not only that they get limited opportunities, but they also miss different opportunities. One of the participants who was a graduate one, but he said that he had to appear for interviews, job interviews, but when he started his journey, he has to negotiated with the drivers and traffic congestions. And when he reached, the interviews was already over. So that was one example of it. In addition to that, sometimes they have to take underemployed jobs, like they have to it's not like since they cannot reach to a certain destination, so they won't take up the different kind of jobs, but sometimes they are forced to take job which is nearby. So even it is less paid, they have to accept it.
Your time is up.
Yeah. So in conclusion, what we can take up, like, the mobility of the people with disabilities is not a social issue, but we have to see it from the rights perspective, as the sense concept of capability says that it should be there is integration of equality and human rights, equality in terms of autonomy, equality in terms of the outcomes, as well as the process or the mechanism of the whole story of moving, starting from the beginning of their journey to the reaching to the destination. In addition to that, we need to include this idea of capability approach in the public policy, so that we can include the voices of the subalterns. And we also, through this study, we also try to explore the hidden disadvantages of in terms of the social and cultural perspective, or the dimensions which are associated with the high cost of accessing public transport. And the last, we would say that we need to make the policies more inclusive, so that not only for the people with disabilities, for other vulnerable groups like older adults and women should get a safe, affordable, accessible public transport for their well-being. Yeah, thank you. I will stop here.
So good afternoon all. Just 2 minutes need to introduce APD. APD, the Association of People with Disability, started in 1959. Yesterday we celebrated the 64th birthday of APD. Thank you. And Ramana Rao, who is Padma Shri awardee, Dr. Ramana Rao, was the chief guest. Yeah, there are around 600 people celebrated, and we follow life cycle approach. Earlier, different technical work we started, but after realizing things, what we can do in future, this is our vision and mission. We follow from early intervention to geriatric support. We have started, and the same model we have applying in all the districts where we are working now. So they're not specific to one disability. We are covering almost 18 to 19 disabilities in Karnataka, and in South India also we are exploring our space, and 3 states we have entered to work with disabled people. So I will start with this question. So everything is available in online. Do our PWDs need any accessibility or movement? So this is the question raised by one of my senior leader in PWD sector. Why we have to focus on this topic? So the answer is very simple. Our presence makes the difference. If we are not visible in society, if we are not visible in public spaces, if we are not visible in all the dialogues, so nobody will talk about us. So that is one area gap, how to fill it. So this is one paper I try to explain what are the disability perspectives we have to follow. And it is a secondary research paper focusing on urban transport, particularly in Bangalore area. So yeah, as we know, through the civilization, how cities have been developed, and this is really one of the innovation of human being. The great innovation. So we are living in these cities, and accessibility, always accessibility or access for general people and for disabled, it is different. For general mass, it is connected, simple connectivity. But in the context of disability, it requires technical knowledge, expertise, and some policy understanding. See, because that within disability, now there are 21 types of disabilities, disability conditions, and within one condition, there are 4 types of different levels. Intensities you can see from mild, moderate, profound, and severe. So if you take intellectual disability in one type of autism, within autism, again, you have to take. And if you go with the broad spectrum, so we can, it is almost like we are going to reach 300 to 400 types of disabilities within disability. So this is the reality, and each disability needs different kind of support in public transport or in transport area. So Bangalore, you know, is capital of it, Karnataka, and IT capital of India. And it is interesting to see that 90% of population of PWDs of Karnataka are residing in Bangalore. It is almost 2.55 lakh people, PWDs are in Bangalore. Total 13 lakh plus are in as per the data. Now, if you add 21 disabilities, earlier seven disabilities has been calculated in census. Now it is 21 disabilities. That means within disability, at least 30% of disabled population of Karnataka are living in Bangalore. So that is this is the reality now. So census has not been conducted because of there are different things happening with the census. Being part of a census training committee, and I'm part of State Access Advisory Committee, part of Election Access Advisory Committee. See, push and pull factors. Every day I'm witnessing and experiencing it. So disability is a costly affair, and urban transport makes disability as more costly, and resulting in increasing inequality. I'm a parent also. I have a speech and hearing data. It is my empirical experience. I don't want any other's experience. See, just to buy one battery for hearing aid, the battery cost is 20 rupees. I'm residing in Ramamurthy Nagar. I have to come to Lingarajapuram to buy that battery. I'm spending almost 400 rupees per auto because there is no other public transport at that point of time. Number one. Second thing is, my wife, who was working in a private firm, has to leave the job because of, we came to an understanding that, Baba, take care of my daughter. I will go for work. Very difficult. Otherwise, we are going to suffer a lot. So this is a compromise we are making. So the urban transport or the living expenses here are making us more vulnerable, and this is one factor. This is reality for all the parents who are living in Bangalore. Yeah, in Karnataka you can see the in any place, for example, PWD needs rehabilitation support, education, employment, then all other supports, recreation, or religious visiting religious places within Bangalore. So these are the important things. But as my earlier presenter said, it more money we have to spend. So on one side, policies are saying, the legal parameters saying we are talking about rights of persons with disabilities and equality. But in reality, this is the picture. We are increasing, and we are not reducing the poverty of any families of disabled people. So that is one area. You can see the data available in the internet, where our majority of people are families of persons with disabilities are coming under BPL category. That is also one factor, because why it is still containing that? Because we are spending more compared to other people. We are spending more just to maintain the disability, not curing or giving treatment, just to maintain the disability. So accessibility of bus and bus stands, a lot of research has been done in this area. I have collected some data. This is a common, whether you go to Kerala or Kolkata or Bihar or in Karnataka. In every bus stand, conductors will call the people. This bus goes to a particular place. Yes, there is a good practice. I think naturally that practice is there in our society. But what about the wheelchairs? They might call wheelchair users. They might call, conductors will call the people. How can we enter without basic facilities within the bus? Bus is having handrail, but no ramp. So carrying a person inside the bus, it is a question of dignity of that person. You should not carry. And wheelchairs, we cannot kept in the bus. There is no policies are saying, orders are saying that yeah, chains are there. So we have given space for wheelchair people. No, that is not a reality. So if you visit any bus in Bangalore, so you can feel how it is. What is the disability? What is the items available as we can say it is disable friendly. And the data, recently I collected the data. So across India, only 7% public buses are fully accessible. And 1 lakh intercity buses are operated in different states. And only 2% are fully wheelchair accessible. 26% are again partially accessible and 70%, 74% fully not accessible. So this is the bus issue. And in Bangalore, if you talk about Bangalore, this is recent data, 22nd July 2022. The press release done by Transport Department. I collected the data. So in Bangalore, they are saying almost 6,000 plus buses are disabled friendly. Have you? I think you have traveled in Bangalore. Can we say? I think from ISEC, one study has been conducted. I think Nagesh, Prajwal and other people have involved in this study. They have identified some gaps in bus stand and bus shelters, like there's no lighting and payments are not seen in anyone, and neither the bus stop nor the shelter is having basic facilities. This is one thing we need to address it. And in the Karnataka state, which always claims we are very disabled friendly state. Yes, few concessions has been given, like bus pass concessions. For visually impaired people, enter Karnataka, it is a free bus pass. For other disabilities, they have to pay 600 to 700 rupees per year, and 100 kilometers radius from their home. They can go anywhere. But the bus pass applies only for KSRTC buses, not for Volvo, not for Vajra, not for any other Airavata or luxury buses. Yes. Yeah, bus terminals, yes. Somewhat we have witnessed that disabled friendly toilet is available, and platforms are a little bit becoming disabled friendly, and buses are at district level bus stands I'm talking about, and local level we don't have. And recently the government of Karnataka came with one BMLTA concept where it is going to unify all the departments in one bucket, so that the urban transport issues will be resolved. But the activists are alleging that it doesn't follow any public consultation, or it doesn't follow any equal basis for all the people. And a lot of allegations, a lot of questions came to this group, and we don't know. And the interesting part is, as soon as the chief minister announced the this authority, in newspapers, it's claiming that the people who are violating the traffic rules have to pay hefty fine up to 2 lakh. Trains, yes, trains are accessible. Railway stations are accessible, not the trains. And there are reserved seats for persons with disabilities. And recently, one CAG report says a 10-year-old boy has got under the freedom fighters quota. So we don't know what is happening in reservation of tickets with of our PWDs. What is happening? It is a gray area. We don't have any data. Namma Metro, yes, everything is good, but seats are slippery, and PWD has to walk a mile to reach a railway station, and there is no concession in metro. This is public money. So how the public money has been utilized, and at least PWD should get concession in this process. No. Yeah, this is what we have always say. Nothing about us without us. In any policy matters or any decision making matters, the ableism dictating the terms. The mindset of ableism, I'm not talking about able people. The mindset itself is dictating us, and the civil society never bother about what is happening with PWD policies. That is one area I think I am really thankful to ISEC. At least academia is started to talk about accessibility issues. Yeah, the conclusion is we are not part of full development. We are not part of development projects, smart city projects. Without budget, accessibility cannot be realized. Transportation or transport related infrastructure cannot be realized. So within that transport and transportation infrastructure, we are having our own claims. So we are not able to claim because there are dearth of NGOs who are not working on policy work, and majority of NGOs working with rehabilitation and other issues. Yeah, regular reviews of Accessible India campaign is one of the way to resolve the things. And civil society, I always say civil society has to play more role. And the gap from our side is we are less numbers. Democracy works only on numbers. Thank you.
Thank you very much, Mr. Babu Khan. May I now invite Divya Susanna Patil and to present her paper. Transportation barriers leading to delayed medical care for older adults with disabilities in Bangalore, India.
Thank you. So, good afternoon, everybody. Yeah, I am Divya, a PhD researcher under the ICWIMOB project. I'm based at Manipal Academy of Higher Education. So, yeah, my supervisors are Professor Bailey, Dr. Sobin George, and Dr. Lena. Yeah, so today I'll be speaking about the transportation barriers which resulted in delayed medical care for older adults with disabilities in Bangalore. So just a quick introduction. According to the NSSO 52nd round, 40% of the older adults have one or the other disability. And another report mentions that there are 219,668 disabled older adults, that is 60 and above. And also the data states that disability increases with age, and it is more commonly seen in males. And the most common disability is locomotor disability. And again, the common reasons are arthritis or other orthopedic related issues. So for my research, I used the 3-delay model, where though the model was originally used to identify factors which resulted in maternal mortality, what were the delays which resulted? So I used this theory to this model to identify what were the delays for older adults in reaching care. So the main objective was to explore the transportation barriers that resulted in delayed care for older adults with disabilities. So the study was conducted in Bangalore this year between March and April. And I was able to conduct 21 in-depth interviews with older adults who were frail, and some of them who had locomotor disabilities and were using assistive devices like either canes, crutches, wheelchairs, calipers, and prostheses. And there were very few with wheelchairs though. And I also conducted 9 key informant interviews with healthcare workers or even with NGO workers who work with older adults having disabilities. So ethical clearances were obtained. Just before I go to my findings, I just wanted to give a quick overview of the hospital healthcare system here. So we have the government hospitals and the private setup in Bangalore. So under the government hospitals, we do have this primary health centers, which are there in almost all the wards. And then they provide primary care, basic care. And then we have the community health centers, and then we have the district hospitals. All of these are situated mostly in the city, and private hospitals are distributed across everywhere, like the tertiary hospitals or the private clinics and or the general practitioners. So coming to findings, why I mentioned this overview is later in the findings, I will be talking about it. So most of the older adults who I spoke to and who had disabilities or who were frail and not able to walk or move around much, the first thing and the only thing which they told is they were not able to access any of the buses. As in the previous presentation which was mentioned, the only question they asked me is, how will I get inside a bus? When I asked them, do you even use a bus? So the most common mode of, and even the metros, it's not only the seating. There are some of the lifts which don't work in the metro stations, and they ask, how do we even go upstairs? They cannot use escalators. So they have the fear of using escalators. And hence, going even up to the metro station to the platform was a challenge. So they were left with only options of autos, cabs, or personal vehicles. So again, cabs and autos, cabs are more expensive than the autos. So most of them who could afford were using cabs, and if they had someone to take them, they were using the personal vehicles. So one of the older adults mentioned that to go to the hospital and come back, they will charge rupees 300. So it is expensive, but they have no other option. So so only when there is an emergency, they go to this extreme of using that auto and going to the hospital. Otherwise, they try to stay back at home. Then distance and commute time. Most of these hospitals, like I mentioned, the government hospitals are free, provide free service, but they are located only at particular places. And if someone has to go to this hospital, they have to travel a long distance. And it is sometimes difficult for them to sit in even in an auto for such a long time to reach. The commute time was too much. And as one of the older adults mentioned, the government hospitals are far away in the city and they cannot reach these places. So, and again, they had to be dependent on someone. So in the same quote, even after getting off the bus, I will have to walk and go to the hospital. I cannot walk there. If my son must take me and go, then he must leave his job and come. If he leaves the job, how will they run the family? So this was all interconnected. So dependency was one more thing which which came up among all the participants, because they could not go anywhere alone. Availability of transport. Some of the older adults, like those who were from middle income groups, who were able to even provide for a personal driver or have an auto, had to again depend upon that auto driver or the car driver to go to the hospital. So if that person was not available that day, they cannot go to the hospital. And there were older adults who had falls from the bus because the driver just moved off, and hence they stopped using the bus itself. And this is one of the reasons why these were some of the transportation challenges that came up. In addition to this, this is where I just there were many other factors which were interconnected with this transportation barriers itself. So there were many factors regarding before even thinking of reaching the hospital, it was they had to make a decision whether they want to go to the hospital. So the reasons why they had to think whether we want to go to the hospital is this dependency. So they had, because they are depending upon a family member, they had to wait until that family member is available. Another thing is they are financially dependent on their children. So most of them do not get pension. So it is only those who are working in the government who would get a pension, and they did have insurance. So they were able to go and get the treatment, but those from low income groups had to depend upon their children. So again, they had to depend upon the family member to help them get down from the auto also, even if they were to use an auto. Then expensive healthcare itself. So again, they are dependent on the children, so they were like, we don't want to become a burden for the children as well. So private hospitals, if private hospitals were close by and if they had to visit the hospital, it was too expensive for them to pay for it. Health literacy among the older adults as well as family members. By this I mean there was a lack of awareness about various illnesses which older adults go through. Like for example, when I spoke to a few of the key stakeholders who worked with either patients with dementia or any other mental illness, they mentioned that these signs and symptoms were not identified earlier. So even the older adult just neglected it, and the family members also thought that, oh, my parents are getting old, so maybe that is why they just neglected it, and until it reaches a very severe stage where they become aggressive and stuff, so that is when they realize they have to go to the hospital. So I think the lack of awareness was seen both from the families end as well as the older adults. Transportation barriers I already spoke about. Again, coming to infrastructural barriers with respect to built environment. So as mentioned, the footpaths, I had many pictures. I just put them in one slide together. I can show it in the next slide, where the footpaths are all covered either with garbage or vehicles riding on the footpaths, which is so common in Bangalore. And literally the older people, or even if they have using a walker or something, have to walk on the road where all the other transport modes are moving. Coming to delays with receiving healthcare itself was sometimes inadequate healthcare, meaning maybe there's lack of staff, or there is no there are no geriatric there is a geriatric ward in the hospital, but there are no trained professionals for that. And so the care they receive there is less. And most of the older adults also feel that they go to the hospital and that they do not get a treatment. They're not satisfied with the treatment that they're receiving from there. And they say they are not considerate. Like older people say, sometimes doctors are not considerate. So why should I spend 1,000 rupees and for the cab and go till there and come? It's okay if I sit at home. So these were some of the key findings that came up. Like you see in this picture, you can see the footpaths have all the vehicles, and here riders on the footpath, garbage on the footpath, and there the older person has, with the crutches or the walker, has to walk on the road. So the impact of delayed care, these were some of the findings that I got from the key stakeholder interviews. So it increased complications. They came late, and that increased their hospital visits. If it was supposed to get over, like if their treatment would have been done in 7 days, just to avoid paying for the auto or anything for those 7 days, they end up paying even more than that. So it increased their financial burden also, because they have to pay for transport now as well as for the treatment. So in conclusion, I would like to say that most of the older people with disabilities came for they have more issues, but they came for preventive treatment. And most of these were linked, transport barriers were linked with other multiple factors also, and it resulted in delayed care. So strengthening intersectoral collaboration between the local government, the transport sector, and the health department could be recommended. Like there could be a population-based strategy, like to see how many people would require a transport mode till the hospital. Increasing awareness among older adults, family members, about early detection of health conditions for them. And this could be done through like school programs, medias and all. Improving geriatric care at public and private hospitals. I think this is very important in addition to providing health insurance for them, which would help in getting better health outcomes. Thank you.
I think we have now excellent time for discussion. So the floor is open for questions, comments.
So again, very good presentation in the session and on very important topic. My question is to Divya. Instead of a question, I was just thinking, especially when it comes to accessing healthcare. Of course, there is no argument or no doubt that infrastructure and other aspects need to be strengthened. But is there any thought consideration of, let's say, telemedicine facilities? For example, government have this e-Sanjeevani OPD, and apparently they claim that a lot of people use that, and they've been using it during COVID, after COVID as well. So is there any sort of discourse around telemedicine services for people with disabilities?
Yeah. So, oh yeah.
Thank you, Shirish. I'm taking clue from you, Divya. I think we also may need to look at it across these differences within that group, because this experience can vary across different economic class within that. So when I got it clue from Shirish's question, because the people who are very poor may not be able to access internet. So would you be able to give a little more insights into the differences across participants so that we can contextualize it well? Thank you.
I have a question for you. One important condition faced by older people is violence within the family. Now, that is something that is hopefully you're aware of, and keep that in mind while you're interviewing your old people. Second, before telemedicine or something like that, I think one important thing we should remember is we used to have a system of family doctors who could visit them at home, and it wasn't too expensive. Why can't we think of something like that? Training medical or non-medical people to do regular home visits. I mean, why can't we have a system of multipurpose workers, ASHA workers, etc., in urban areas also?
I have a question like regarding like what kind of health, is there any specific health issues you have targeted, because and how they're aware, like if because these are most of a perspective you have taken from your focus doctors and all, and also the patient like respondent, but whether what kind of evidence you got, like whether the doctor they are aware of whether because of delay their health has been aggravated, or they have to pay, like whether the respondents are aware that because of delay whether they have to pay extra, or like their health has been aggravated. That one thing. And another is like similarly, like that sort of suggested like regarding the health visit. Even recently Bikram Patel has also posted about that ASHA workers for older people. So whether in some places those kind of things are available or not, or whether they are using also, because even if we see in older people, all this concern, there is also that people use over-the-counter medicines which are easily available nearby. So how, whether there's also a barrier in accessing those kind of things. So that I just want to know.
Yeah.
Divya?
Okay, thank you. So answering Shirish's question first, telemedicine. So one thing that I found about telemedicine itself was even in my previous set of interviews as well as this time, older adults were not tech savvy to even arrange for this. So in my earlier interviews of the first phase when I went in, at least some of them are staying with their spouse or themselves. Even then, they struggled to go through this telemedicine. But this time, those who were living with their children, most of them had to be dependent on someone, but yet they did not go for telemedicine. Uh, Even when I asked them during COVID, could you not call the some of them were so they were like, no, I took medicines whenever, whatever I had, that's all. And one thing is they were very clear they cannot even book an appointment on their own for the hospital, for private hospitals. So even if it is a higher income group, so their children had to do it for them. So, and lower income groups did not go so much so often to the private hospitals. So this was one thing. And did I answer your question? Yeah.
Yeah, I think that, yeah, that is sort of expected or anticipated that older adults would not be very technology comfortable. And so there will be assistance required, there is no doubt. I was just thinking in terms of whether it would, it would reduce the kind of assistance that is required or make it little easier so that at least the delay can be prevented. And therefore, if the effort has to be done, they has to be done from the system and not from the individual themselves.
Yeah. If you ask me personally, because I spoke to a few of these stakeholders, some of these NGOs do help some older adults book appointments and these kind of things, to book appointments with a physiotherapist to get, but again, these were all among upper middle income groups who were able to pay for these services. So everyone cannot do it. This is one of the things. And
what is the, I think the question Shirish is also asking is that where is the social capital, about social network? What is their role in supporting them in accessing digital or telemedicine or this kind of?
okay, so I still feel the these kind of volunteers or someone could still help in doing it.
But why not directly the health system take the responsibility?
When I asked the health system, especially the doctors from the government, they said it is not
Yeah,
our
so
job to.
I don't mean like
Yeah.
specific personnel,
Yes.
but so you have like set of recommendations for health systems to
Yes.
reduce the delay in access.
Mm.
Could this be one of the, because the government has already initiated a process like incentive and whatever. I don't know anything about what is the level of services that we provide. But just to consider or explore if there could be an option that can be recommended or better.
Yeah, could be definitely. And economic classes, yes. So I did have a mixed group of people, like from lower economic groups as well as middle income, upper middle income groups. Again, when I say in my earlier interviews, at least there was a little bit of difference. But here in this current set of interviews, I feel it was all the same. Most of the answers that I got from them were like, when it came to accessing, they had to be dependent. They had to wait for somebody, even if they had money to pay, they had to wait for somebody to come along with them, even to move around in the hospital, right? It was difficult. Like, I think Ajay already morning he mentioned about the hospitals here. I did have few videos, but didn't add it here. It is difficult to even move from the entrance till you reach the uh, physician to go till the OPD. So they require someone along with them, no matter what income groups they are in. And family doctors and ASHA workers. Yes, these were few of the recommendations when I spoke to the stakeholders. There were few doctors who did mention to me that ASHA workers could play a very important role, but we still do not know how well it is going on in the community. So uh, we do have these PHCs, OSHA workers, yes. We do have PHCs where the PHC medical officer manages these workers. So they are there in the field every day. But it is there were suggestions from few of the doctors themselves who said that these workers could go to each of the houses and they could do the basic things like find out what are the symptoms, signs, if any initial findings are there, they could report back to the PHC. These are the things which could be done, but they're not sure how strong it is everywhere. So, yeah. And these health issues, I don't know, I focused mainly on older people who had locomotor disabilities, not any particular disease. So, but the most common thing that is seen among older adults is NCDs. So diabetes, hypertension is one common thing which everyone literally were mentioning. Some with cardiac issues and other complications who have. So, yeah. So the health condition was not any specific condition. For example, if I could tell, if somebody had a fracture and had a surgery, should come for physiotherapy for a follow-up, right? And if they are not coming for that follow-up, they end up with stiffness. And some of them do not come because they have to pay nearly 150, 200 rupees for the auto. And so there is stiffness, and beyond that, they lose more mobility. So already they are old, and then when they have stiffness in either the arm or anything, they lose function of so many things. So again, coming to some of them having just a cough and stuff, it might be wheezing or severe respiratory infection. They don't recognize it earlier, come later, and then end up with pneumonia and things like that. Again, with hypertension come with stroke. They reach when it is at the stroke stage. So I didn't specify any diseases. I just asked whatever were the complications.
Thank you, Divya. But I would like to make a personal general comment. One of your recommendations was on insurance. Now, it is the way the government of India is now proceeding. But a lot of us public health workers have profound doubts about this American model of healthcare, which is being suggested. And what we argue is that insurance model is inefficient, expensive, not sustainable. And instead, what the government should do would be to provide for healthcare services. Taking money into insurance takes away what could be there for provision of healthcare services. And it is another way in our country of a public subsidy to the private healthcare system. So I would like you to be cautious in recommending health insurance. Now, shall we move to Babu Khan's questions for Babu Khan, his presentation or comments?
I think it was an excellent presentation she made, putting forward a lot of key points. I think this is just a suggestion, not even a question, that there are provisions as to what we call as route optimization processes. I was thinking, as you were speaking about, that BMTC probably has 6,000 buses, which they claim to be access friendly for PWD, or for the matter, they would have provision for ramps, I'm supposing, or they would be probably low floor buses as they may be coming in. But I think there could be a basic issue where the member or the person who is the conductor of that bus is not making that particular facility available, or he himself might not be aware that there is a provision that you could open the flap and put it against inconvenient infrastructure in place. But in terms of route optimization, I was thinking, could there be a proposal for a facility where you request for a route where such buses fly? There could be routes where such buses are not flying, where there is a need by PWD members and person with disability, and they could raise this and basis, what is their flow, or they could request a time slot wherein, if it is work related, what do you say, travel, or a clinical visit travel, they could request accordingly. So this is one thing where I think there is one case example wherein, I'm not sure if it is Japan or somewhere, where in areas where buses are plying with low population density, you have a request call or something at public bus stops. But this is something slightly in a different direction, where you raise requests given on the possible route that a redressal system or an addressal system, not even a redressal, an addressal system is there, where the corporation itself takes note of the requests which are coming along a specific route and make provisions and frequency of those buses available. This is one possible solution which was coming to my mind. That's it. Yeah.
Just adding to what Pramod is saying, what you see in European countries now with this population decline, that certain services then become on-demand services. Right? So in similar line, where public transport could then be asked for specific neighborhoods or areas that once in a while that they would have these on-call kind of services. So there is no loss of kind of that the buses don't necessarily run empty, but because it's on demand, that there will be someone who would make use of that service.
Yeah.
So I had a slightly a broader question to Mr. Babu Khan. So since I asked this basically because he comes from the group of advocacy and also for not-for-profit background. So during the course of the research on the phase of persons with disabilities, especially looking at the transport and access, there is also this very emotional conversations that come out from the stakeholders, especially from the not-for-profit, that there's an urgency for action, and research in a way is something that it's more critically looked upon, especially like, there's a notion that the transport barriers are obvious. Everybody knows the issues, what the issues are and what needs to be done. So this is the kind of outtake, the emotional outtake that we have seen from the stakeholders. But so what was I was interested was that Mr. Babu Khan had a very positive outtake on the research, what it could bring to the discourse of transport and disability. So I just wanted to know, like, so which are the elements where qualitative research can bring something new to the table to understand transport and disability, which is already not there? And why do you have this positive outtake, which I think we couldn't see much from the other stakeholders? Thank you.
Is there any other question for Babu Khan? Comment? Okay, Mr.
See, after a certain point of time in my life, I was also very negative, very emotional, while working with school for my daughter, and coming in bus, all the things has been done for 20 years. Now she is in diploma in computer science engineering, studying JSS in Mysore. So that experience as a parent, that experience has led me to become more mature. So that is one area. So where need to be compromised, where need to push the ideas. So that is one personal experience reading. And second thing is, yes, I agree with that quality research is not there in NGOs. So one suggestion we did in one presentation. So we are going to start one new project where I can invite many people to do research. It is the project named as Right to be Seen. So we are going to launch it very soon. The experiences of PWDs personal experiences of PWDs who are going for work or who are going for travel or who are going for excursion, for example. It has not been recorded anywhere. So those quality data if we get, so easily we can influence the government. Second thing is I believe in working with government and in collaboration, networking and collaboration with the government department, so that slowly we can bring the change. Because accessibility is an emerging area. It is not fully implemented. It is an emerging area. It takes time. If you take the previous decades, we struggled to enroll ourselves in census. Up to 1991, there was no census done for PWDs. Earlier, during the British period, there was census for disabilities. That's all. From 1991 onwards, we became data. We are not data at all earlier. So after entering into census, now people are getting voter ID card. So this is the gap, historical gap. So how to address it? This is a very historically backward community. How can we address these issues? Not in emotional ways, so that we can convince the government officials. See, policymakers or government officials are not experts. They are implementers of certain projects. They go with, they go with economic number and beneficiary, finance number or beneficiary. That's what they understood. So recently we did one research with the Urban Development Department, particularly the what is that? The Directorate of Municipal Administration of Karnataka. We did access audit of all the urban local body buildings. I gave 20 points. Finally, the IAS officer and other people came with 5 points. Mr. Babu, you are expert. You are not expert. These are the 5-6 things we can do. Low laying fruits. We do it first, then go with 7th point or 8th point. See, that's how government works. And I firmly believe that government is like elephant. It is slow. But if it forward, if it moves, it will be a foreign step. Nobody can change it. See, that's how government works.
His question, his comment. Okay. All right. Now open for comments and questions. Salim, I have a question. You interviewed 10 rickshaw pullers and auto drivers. You didn't say anything about what they said.
Sorry. Thank you, Chairperson, for this opportunity. This is an observation because I felt that you began the presentation of Amartya Sen's capability approach, but in the only I could find out only in the last slide where you have tried to link up the interlinkage of capability approach with the designing the inclusive public policies. But it should come in the analysis. The link is missing. So how exactly the capability approach might have the relevance in the formulation of designing inclusive public policy? Yeah, it's a interesting area, but it needs to be explored as strongly as it has not yet come out. That's my observation. And my second thing is that what are the government schemes and programs are there any specific government schemes or programs? Is there any opportunity, whether you have reviewed or as part of the review of literature or in terms of contextualizing this particular problem? So these are my observations. Thank you.
So adding to the last question, it's a general question, anybody can answer, any of the presenters. Could you please shed some light on the best practices that we have followed in inclusive mobility or inclusive cities as such, whether in India or abroad? I don't know if something exists in India. Have you also reviewed something like that? And we can discuss further so that to have a better understanding about what was already done somewhere else, and or maybe why it cannot be done, why it's not successful in some places, something.
Just adding one more point to all the presenters from last section, adding to Fatima's observation. I think there is something called as universal design, which is being worked upon. I think it has to be thought of by the planner, the architect, as well as the urban designer. So collab between that. Is there any observation or any any data which you have, which you can put forward that how successful it has been? I have only heard about it. I'm not very sure about its implementation, to what scale it has either hit the ground or is in the conceptualization stage. But I just wanted to know if there is some insight on that, if you could share.
Thank you for the questions regarding rickshaw pullers' contribution. So, in this study, we focus on the people with disabilities on wheelchairs. So, regarding the rickshaw pullers, this is another study that I'm developing on it, like how their role. So, I would like to shed light on how they play a role in mobility for people with disabilities as well as for older adults. Like they think that it's them, like rickshaw pullers or the auto rickshaws, they are the nerve for the mobility of the vulnerable groups, because without their vehicles, the people with disabilities cannot move a single inch, according to them. Like they say, see, we are the people, we help them to get on the rickshaws, auto rickshaws, because they cannot access public buses. They also aware about the fact that they cannot access buses. They are also aware about the fact that they cannot access the other public transport like Uber and app-based transport. So it's them, like whether they charge extra or not, but they perceive it that they are also the assistants and they play a crucial role for urban mobility. So since I focused on the perspective of the wheelchair users, that's why I presented the first part. And the rickshaw pullers is I mean, it is in it's still, we have to develop a paper on that. The whole data we need to analyze it, still pending here. So that's why I didn't present it here. And
maybe you can also mention, like in the previous analysis that we did, we see that these are key people in first and last mile connectivity between these particular areas, and also that for older adults, not just with disability, but for older adults, these are the ones who are actually build these kind of personal connections in those neighborhoods, because many of those rickshaw pullers operate within that particular neighborhood. So in that way, there is that connection, but there are still a lot of power relations that kind of define this relationship between the rickshaw driver and the older adult.
Even rickshaw pullers perceive that it's because of them they can reach to the doorstep of the older adults or people with disabilities. They can, they are the people who can take them from home to the destination, whether it is for working place or for healthcare facility centers. So even it's their perception that they are contributing a lot. On the other hand, when they see the power hierarchy, they said they are marginalized and they are subaltern in the sense that they cannot negotiate with the neighborhood people, because they think they are outsiders, because most of the drivers are from neighboring districts who migrated for their livelihoods. So that also play a vital role in there. Even they play subaltern masculinity, that okay, being male driver is still they feel that they are powerless. So that those dimensions are also there in the mobility, urban mobility for the older adults and people with disabilities. Regarding the capability approach of interlinking, like, so in the initial stage, what I thought that this capability approach, there are many dimensions and capability approach where focus on the functionality of the people. So here we try to look into a specific dimension of the income using it, or whether it's the conversion poverty, what Sen term it, where they mentioned that it's not only the personal income, but the family resources for getting the opportunities for their everyday activities. And where they said it's not only the personal decision of the people with disabilities that for their incomes. So when they going to use it, they have to pay more for their travel, and that decision to go out and to pay extra is not their own decision. It also depends on their family members, because particularly for women disabled wheelchair, where they say it's the male family members, whether it's a father or brother or husband, they take their decisions. Apart from the going for working place, for other mobility, it's the family members who control it. So here we see the sense concept of the equality of autonomy, or equality of outcome or the process. So the whole mechanism of the right to get opportunities come into the role here. In addition to that, we also observe that this method is this theory of capability approach is also applicable for to include the perspective, like what we see in public policy, that it's a top-down policy where it's not people-oriented. So through this approach, we can also include the people's voices into it, into the public policy. What are the challenges they face? It's not only the cost-benefit approaches that we should look into while we're framing the policy, but also the sociocultural factors that also contributed for the higher cost of urban mobility that we have explored here in this study. That it's not only the income, but also how they miss different opportunities, or how the social factors like the attitudes or changing behavior towards the people with disabilities or older adults. And this perspective of an ableism or ageism is also a crucial part of this theory, that we can or we can also include it so that we can make more inclusive policies, including sense concept here. So I think that is there. And regarding government scheme for people with disabilities, that there is when I was going through the literature, so recently I completed one scoping review, and while there I was finding that what I found that there is a certain reservation in public sector. There is a 5% reservation in job for government jobs, but mostly what we have seen that what about the other informal sector where they mostly employed? What about different private firms where they are employed? There is no, because there is, again, it's the government's role to monitor whether the different sectors, whether the informal sectors or private firms are implementing the government guideline of reservation for people with disabilities. In addition to that, what we have seen that again, this perception about the ableism, that whether they are capable of doing it or not. Because one of the participants, recently graduated participant, she was working in an NGO, and what she expressed that, see, though I can work on desktop, but when I appeared for interview, the first question was, how can you come to the working place? So I had this barrier, like how can, that was a relevant question. So I had to change my residence, but that was not my personal impairment. Okay, I got a new residence here, and I access this office. So it's not my personal impairment or inability to do job, but it's the perceptions of the community people, or those who are working and looking after those sectors, or the recruiters. They should little bit of sensitive towards the older adults issues or people with disabilities issues, where so I think with this, I think we need to take more like impact evaluative kind of thing, that how different sectors are implementing these guidelines of the government, what they have suggested. And regarding Fatima's question, like what are the best practices for making a city more inclusive, is like till now we have what literature says is the disable friendly cities or age friendly cities by WHO is one of the framework that have been implemented in the developed nations. But we have to think about these are whether the capability, what I was trying to explain it, like the capability or the capable abilism is a context based. So in our context, whether it is in developing South Asian countries, so we have to see what are the factors or dimensions are making difficulties or challenges for the people with disabilities. So here we can see if the disable friendly cities can also be implemented in our cities, including the context that we have in our developing countries, whether it is the built environment infrastructure or the transport facilities or the design of the physical design of the different public transports, how those are acceptable or those are accommodative to the wheelchair users or other forms of disabilities. Regarding this planners, urban planners and architects, yes, what we have seen that the government perspective is still we have seen it's the cost benefit thing, that if we are investing some amount of resources, then how when we can get it back. So again, I think it should be the people oriented perspective, where the people with disabilities should also be included in the public policy, so that they can all explain their issues, because in public policy still we see it is those who were working in the government sector, like policy oriented, like they are also dependent on the data that the secondary data they have with the government data they collected based on whether it is census data or other family survey data. But I think that to make a city more inclusive or the mobility more inclusive, I think it's the voices of the people should also be considered, or should also be taken into account in the public policy itself, so that and of course the goodwillness or the goodwill of the government, good governments, we need to implement all these policies at the ground level, so that we can make the cities more inclusive, not only for the people with disabilities, but also for other vulnerable groups, including women and older adults. I think, did I respond to your question?
Yeah. Add something to what Salim also mentioned. When it came to the schemes or the policies that are already there, even to avail these schemes in India, I think you need to have this ID card to get the disability card. So what I found when I spoke to most of these older adults was they found it even difficult to get that card. To get it done, they had to go through a huge process. They have to go to the doctor, get themselves checked. All this has to happen at the government institutions only. And they had to wait in long queues. They had to wait for a very long time. And probably when it came to Salim's research, there were younger people also. But when it comes to older people, they are already exhausted. They are like, no, for what reason should I go? So it's okay, I don't need the card. So without that card, they actually cannot get a lot of these schemes.
In addition to that, but I forgot to mention one thing, like the people in Dhaka, the people with disabilities are known as golden citizen. It's a government scheme, or the Sonali Nagorik, where they get 700 to 750 taka per month as a stipend for people with disabilities, but that is only for those who have this disability card. And for to get that card, it's very hectic and very painful for them, because one of the participants was saying that, see, we get this card, so we have to go to the commission office, like Human Rights Commission office, but that office itself is not accessible for us. There is no ramp, there is no it's a stair. So when I had, I had to go there, there were two my colleagues who took me and they lifted on their arms to the third floor of that building and to get that card or to give my documents and all. So that was another challenge for them to get that card, I think disability card. But it's very really irony for them that we are known as a golden citizen, but we see like golden in what sense? So these are really painful things that they have experienced, shared with me when conducting the fieldwork.
Thank you to all the paper presenters. They were, in general, very illuminating, brought attention to special problems faced by people with disability in various aspects of urban living and accessing medical care. I will not sum up the papers. What I will do is to make some 3 general points, which I think are very important for people working in this area to give a thought to every now and then. One is the issue of marriage and sexuality of disabled people and the right to family formation. Now, how respected is this in our respective areas is something we must give it a thought. I'm aware of one classic judgment from the Supreme Court of New York. This involved a hearing impaired couple who happened to be a lesbian couple, which is recognized as a form of marriage in New York. They were hearing impaired and sought to have a child through IVF. And they advertised that they sought a donor sperm from somebody who was hearing impaired. Now, this came to the attention of the court. I don't know if the police brought it to attention, but the New York State Supreme Court ruled against this, against their right to access a hearing impaired sperm. This is connected to the second point I'm making. Today, we have advanced technical methods, genetic screening, pre-implantation, genetic diagnosis, etc., to detect more and more fetal abnormalities. And so today it has been described as the age of neo-eugenics. This is not eugenics of the classical sort, where the state decided who was to be born and who was not to be born. Neo-eugenics is where parents or couples themselves decide on the basis of whatever screening they wish to undergo, whether or not they want to have a child, and this gives them a right to abortion. Now, this is an extremely complicated area because you have a global reproductive industry pushing India's global reproductive industry to push the government of India to keep raising the permissible age for time limit for abortion. As you know, it was 20 weeks. It's now been increased to 24 weeks, which means that more and more pregnancy can then come in for scrutiny and permit abortion. There's been a famous case in Bombay. I forget the name of the lady. In that case, the Bombay High Court ruled that she cannot have the abortion because she'd exceeded 20 weeks. So a lot of people raised the issue of reproductive rights, the woman's right to have an abortion, etc. And so partly because of the push from gynecologists, reproductive industry, etc., it's been raised to 24 weeks. What was not mentioned in the papers is that this woman did not file the case on her own. It was Dr. Malpani who funded her. And Malpani is one of the biggest doctors in reproductive health care in India. IVF, surrogacy, etc., etc. It benefits the industry to bring in more and more fetuses under surveillance. There's a lot of money being made there. So it raises ethical issues. It raises questions about the industry, which is raising or setting the agenda in many of these points. And finally, questions about genetic screening and permissible abortion or not. I think the disability rights movement in India has taken very problematic positions on the issue of abortion. They have come down very strongly in an anti-abortion mode. And I think that is very deeply problematic because there's a conflict with a woman's rights to her body and a woman's rights to abortion. Now, the third is a general point that I'd like to leave you with. We all want better cities, better planned cities. We all want universal health care, quality health care. We all want a certain kind of welfare state that was built in Western Europe. We all want universal education, including higher education. It need not be just primary education. Now, the countries in the world, mainly Western Europe, America is always an outlier, which could implement these in the 20th century. Were Western European countries, these were colonizing countries, right? And let's not run away from that. The Queen of England is the Queen of England, the wealthiest woman in the world. Her son does not now pay an inheritance tax, which is there in England. We don't have it. Now, in the beginning of the 20th century, the proportion of the GDP in these countries, which came from direct taxes, was about 10 to 11%. Over the course of the 20th century, particularly after the Second World War, 3 measures were introduced: progressive taxation, wealth taxes, and inheritance tax. 3 measures, okay? Progressive taxation, the more you earn, the more you pay in tax. Wealth tax and inheritance tax. These 3 measures together, among other feats, some others, but these were the 3 main instruments. Increasing education, increasing incomes, the middle class formation, etc., are all important. But these were the 3 main instruments, fiscal instruments, that increased the proportion of direct taxes to 40 to 50% of the GDP. It was this increase that made possible everything that was done in Western Europe. Universal health, universal education, etc., etc. Now, when England was earning only whatever 11% of the GDP came from direct taxes, that entire amount went for colonial administration and for colonial wars, military. They had nothing left for the civilian population. It was only these other measures, fiscal measures, that allowed the states to take on these features. Now, since 1980, the proportion has been coming down because of neoliberalism. And that is why the privatization push, because the state lacks resources now to provide these things. Let's look at India. What is the proportion of direct taxes in our GDP today? We have regressive taxation. The poor pay a higher proportion of their wages, of their incomes, than the rich do. 11% of our GDP comes from direct taxation. How on earth will you do all that we want to do in our country for the people of the country? Universal health, universal education, etc., if you don't have these 3 instruments: progressive taxation, wealth tax, and inheritance tax. So this is something that we must always keep in the back of our minds. Why are the richest people in India getting away with just about no taxes at all? Our corporate tax write-off, our corporate tax write-off amounts to 9% of GDP. Now, if we did not have corporate tax write-off, we could have had 3% for health, 6% for education. Why is our government constantly saying we don't have funds? We don't need funds from abroad. We have enough funds in our own country. But our fiscal policies, our tax policies, our public policies are not people friendly. We are rich people friendly. And I think I will stop here with that. Thank you very much.
Yeah, we have some more time. Thank you very much, Professor Mohan Rao, living with that thought. Yes, whatever we are discussing, inclusive cities, and even if we say we have a lot of other intervention, we need significant state intervention in that. And probably these are some of the ways through which we need to really think, or when we problematize our research, we should have what exactly are the what exactly we can get it from, where we can bring it from. I mean, like when we need more roads, we need more inclusive designs, and whether private sector can actually contribute to that. If they contributed, what cost it comes, and whether it will be affordable. So such questions are very relevant for our research. Thank you very much for flashing all those things. Now we have 10 minutes. We have two options. Either we can break now, a longer tea break. Otherwise, our friends have something. Some.
From 5 minutes before 4.
Okay.
So then the online team.
Okay. 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 Then if you all agree for a longer tea break, we'll go for that. Otherwise. Oh, really? I thought we have at least. Okay. So yeah, it was. Oh yeah.
I was looking at my that watch.
Somehow I thought that we have more time. Okay, then let's break for tea. Okay, thank you.
You had